and 6.4 with the experimental observational study designs and experimental study designs. And then I plan to show you some examples of studies and try to walk through some of the protocols we might use for developing the study, results from RCTs that I've worked with, and some other approaches like that, just to keep providing you with examples. And then we may just shift some of the association and causation to tomorrow, or we may get to that today. We'll see how the morning goes. So how do you feel about descriptive study designs from that we talked about yesterday and the day before? What are some examples of a research question you might be able to answer using a descriptive study design?
I think for the study design is so how do I say this? Much more not easier, but it's if you have the time, you may have the time consuming, or you may have the limited budget, or you may have not much or being enough follow for the long term. Descriptive is also good to see. For example, the hypothesis is for example, what factor associated with the study?
Okay, so when you're in a situation, you want to answer what are some factors that are associated with stunting in a specific population, and you may not have the ability to do a long-term follow-up like a cohort, but you can do a cross-sectional study to look at, in one point in time, what are some factors that are associated with stunting in a population? So we may be missing, what do we miss out on doing a cross-sectional study?
Because the cross-sectional study is just the period of time. Maybe for the stunting, maybe factor, maybe it's the eating habit or something like that, but we cannot assume only this period of time. But if we follow for the long term, and we can see, or maybe try have some illness or long-term illness, or maybe effect for the studying or something.
Yes.
Maybe some factor that we have to look for the long term.
Yes, yes. So because it's only measuring one point in time, we only have just a kind of a surface level understanding of the relationships between a factor and our outcomes. We don't have temporality, which is an important piece of knowing causality. Right? So if we're not following people over time, we can't establish that temporality. But we can look at associations, and then what would be your next move? If you found that there are some factors associated with stunting in your cross-sectional study, what would you like to do next? Next, we would want to maybe do a more rigorous study design, an analytical study design, to establish some temporality, right, between those factors and stunting. So those are the study designs we'll be talking about more today as well. And when we talked about descriptive studies, if we, does the, I want to check, because sometimes these are English phrases that may not translate as well, but when we talk about the who, what, where, when, why, or how. Which of these can we answer with a descriptive study?
Who is the student?
Who is
Student.
the student or the
Student. Student.
student?
Study population.
So
Who
who,
method of study, right?
okay, so who is getting the disease? Yeah, okay. Okay, and how about what? What is the what?
What is the price of study?
What is the type of disease?
Okay, so what is the type of study or what is the type of disease? So what did we talk about you need to have to understand what is the disease? We talked to, what was it? We had a conversation Monday about COVID-19. What and how we define that, right? What are the symptoms of the disease? But we even have to know how are we defining the disease? How are we defining, what is our case definition? Right? So what is the disease or outcome? And how do we define it or measure it? And what did we call that? Do you remember the term that we used for how we define the disease? Yes, the case definition. Running out of space because I write it big. Okay, and sometimes the what is, maybe we go into a group of people and you have a population and you're not sure what some of their outcomes are, what are the diseases that they have compared to other populations. So you may just be asking a lot of questions about what's going on in this population. And that's a descriptive study, potentially of a new population. Okay, what about where? What's a question we can ask about where? It's not very good.
Place or areas that people like to.
Okay, not only where's the place you'd like to study, but where is something occurring? What are the patterns of where a disease or outcome is occurring, right?
Where's the place of occurrence of disease?
Yes, so where is the disease occurring? Are there particular places that you see it more? What's an example of a disease that you might see?
Dengue fever.
Yeah,
And tropical.
yes, that's a great example, dengue fever. So that is something you experience here, but except maybe in the lowest, the most southern parts of the United States, we're starting to see some malaria and maybe dengue. Nilupa, do you know if that's where, because of climate change? A Zika. Zika
I think there is Zika.
and
There's
malaria. There's malaria, but yeah, I'm not sure about dengue yet. Yet. But yes, we're starting to get it.
Yeah, I think that's pretty effective.
Did I spell that right? Occurring? Yeah, 2 C's, 1 R, occurring. I think. Sometimes when I'm writing,
Occurring, 2 R's, 1 C.
2 R's, 1 C.
Wait, is it occurring or returning?
Where is it occurring? Where does it?
Oh, 2 C.
How about we just do, where? Sometimes when I write things, I'm not sure. Okay, but where is the disease occurring, or where does the disease occur? And then how about when? What's an example of?
When the disease happens or when.
Yes.
the Disease happens.
Yes, so when is the disease happening? And dengue may be a good example of that too. Is there a pattern of when dengue is most
Rainy season.
prominent?
It's almost in the rainy season.
Rainy season?
It's very.
Yes, so you're gonna see a lot more in the rainy season. I'm gonna put. Not that this is gonna help, but when does the disease occur? I'm pretty sure this is, that's right. Okay, and then what about this? What about this why or how? Say again? Oh, were you talking about when is, what about the why or how?
How is maybe that the same person as you how do we divide?
How do we define it? Okay, but this is more about, think about this is more about the patterns, right? So the what is how we define it, this why or how might be when you gave the example of what factors are associated with stunting, that we can get some preliminary early ideas from a descriptive study of why is stunting happening? Why do we have stunting? In a cross-sectional or descriptive study, you might be able to gather data on factors that occur at the same time as stunting. And that's how it can contribute to a descriptive study. But then when we want to know in depth why or how this is happening, we're going to do an analytic study with follow-up time. And usually what else? What are the 2 things that we want to include in an analytic study? Follow-up time and say again.
For the analytics that for I talked about the incident cases or the something.
So we have to, we want to know, we're going to watch people say, and we have their risk factors. And over time, we're going to see who gets the disease, but also who doesn't.
Exposure and non-exposure.
So yes, comparison groups. So for an analytic study, you need comparison group and follow-up time. Okay, those are the 2 components that you need for an analytic study, because you have to be able to watch how an exposure is related to a disease over time, because you need to know this exposure came first and then the disease or outcome. But you also have to compare that to people who do not get the outcome or do not have the exposure. So we're going to talk about that more, but I just want to lay that out here. So how or why are the exposures or factors related to the outcome? And for, I'm just going to put here that for analytic, must have follow-up time and, oh, that was not a very good ampersand, comparison group. So if I did a retrospective study, or maybe it's a case control study of me getting sick the day before yesterday, and Nilupa and I both ate the same mango sticky rice from the night market. But I got GI sick, and Nilupa did not. But I tried to go back in time and look at what are the things I've eaten that could have been causing my distress. But most of it, Nilupa and I both had. So it's hard to say in this, but I needed this follow-up time. I needed to look and say, here's what I had before I got sick. And my comparison group was Nilupa. In saying, well, maybe it was this. And granted, there could be biological factors, other exposures that make me more likely to get sick from an exposure than Nilupa. So who knows? But that is my N of 2 example of needing follow-up time and a comparison group. I don't have a solid causality though for what it was that I had that made me feel sick.
We don't have the right sample size.
I don't have the right sample size. Nope. But I knew it wasn't something I ate after I felt sick. Right? That's at least I needed to have that temporality. Okay. So Nilupa talked yesterday about introducing a cohort study and the type of bias that you get when creating a cohort study. So someone tell me again, what does a cohort study look like broadly? What does the design look like?
We start from now and follow up until for example, we study on cancer, maybe example lung cancer, but we start from the one population and we follow when disease happen in the future.
Mm-hmm.
And we will identify the characteristic like the exposure and non-exposure. But it's the good thing we can know about the disease occurred during the time we follow, not just only the lung cancer.
Yes.
We will see the incident, maybe it's not included our study.
Yes.
Maybe some lost molar use the time, a long time or a lot of budget. Yeah, it's for the course.
Yes, great. So we start with, I don't know if I'm gonna be able to fit this on here, but we'll start with a population and maybe up here, I can try to, we start with a population and we get, a sample of this population. And we have our two groups usually. We may not know at the time when we've recruited everyone, but we'll separate all of the people that we have in our cohort into an exposed group and an unexposed group. We may also watch for exposures that occur over time, depending on how long our cohort study is, what it is we're looking for. And then we follow. So this important piece of having two comparison groups, right? So this is our two groups. And then what are the possible outcomes for each of these groups? Those are arrows, if you couldn't tell, but hopefully yes. You can tell those are arrows. So the exposed group can
Is it on
Hmm?
exposure group maybe happen like a get cancer or no cancer?
Okay,
Or
so
yes.
the exposed group can have the outcome, and I do outcome with a plus and some who don't have the outcome. How about the unexposed group?
The same.
The same? Okay. Okay, so this is just our basic structure of a cohort study. Even if we're doing the retrospective cohort study, we may be going back into medical records and looking, and we still are trying to go back in time to find when people were exposed and separate them into those exposure groups, even if then we have followed them to look at the outcome. So sometimes we can't recruit people and watch them over time as they go forward, but we can go back into medical records and look and see what their exposures were to do a retrospective cohort study, right? But so when we choose who's going to make up our cohort and how we put our cohort together, it says here we have selection bias and response bias. What does that mean? Does anybody remember what the selection bias is?
Selection bias, maybe we include the participant is we include the convenience. For example, if I know her, I pick her in the study or.
Yes.
Or,
Yes, so our selection bias is in how we select who goes into our cohort. And if we're not careful about our selection, then we can bias our results. And there's a few different ways that can happen. Did you talk about, was the like differential misclassification that, okay, I think that'll come. That might be in the next couple of slides. Actually, I think I'm going to talk about this a little more in the next couple of slides. So we have to be cautious of how we select people. We can't just have, people we know, the convenience, as you mentioned. What happens if we're doing a study of breastfeeding and we only select mothers who come to see a doctor at the hospital?
I think for the mother who come to the hospital may have some consultation with the doctor. Is maybe they have some information or consultation. If we compare to the mother who doesn't come to the AAC, maybe they don't have.
Right. So how are mothers who don't come to the hospital or clinic different than the mothers who do?
In terms of the family units, for example, like baby, that people, the mother who always who regularly visiting the ANRCB, they might get the information like Susan mentioned.
Yes.
And their behavior is might be from the mother who
Mhm.
not educated from the nurse or from the midwife. That
Yes.
they lack of knowledge or the information about taking care of themselves or taking care of their baby.
Mhm.
So the behaviors of practice different, so the outcome might be different as well.
Yes, exactly. And so I'm going to repeat that for the recording. But that was basically saying that the mothers who, like Suxman said, that they're going to be different. The mothers who come to the hospital or the clinic may have more information. They have more resources. The women who don't may not have the same education about the breastfeeding or information. Also, do you think there might be differences in socioeconomic status, geography, beliefs, maybe? Those might differ by mothers who come to the clinic and those who don't. And so, like Bob said, it can bias, it'll affect your outcome. If you're saying, oh, well, and we did this study of, I don't know, like vitamin D, I'm making this up, but taking vitamin D supplements and whether a person breastfeeds. And we say, oh, well, there's women who took it, did a great job breastfeeding, but we don't know if any of the women who don't come to the clinic are taking this vitamin D or are breastfeeding. We don't know that information. So is it clear that it's incredibly important how you select your cohort for a study? Are there other examples? Does someone have another example they might have experienced or have seen?
We should do both.
So you say we should recruit them both? Yes. Yes, that is a solution. You may recruit people from both a hospital and from villages so that you can get a more diverse and representative group of women. Or maybe you go to a village and recruit people, but you know some of them go to a clinic and some of them don't, right? You gather data on those characteristics and then you can use it in your analysis, right? But you need to know and you need to make sure that you have a broad group of women who will be in your cohort so that you're representing as many people as possible. Now, if you're only doing a study of women who go to the clinic, that's okay. But you just have to say, this is only of women who go to a clinic, right? And then you can only, what's the word about how we apply our results to a different population? If you only recruit people from a clinic, then who can you make inferences about? From your results. You can say, these factors are related to breastfeeding among yes, mothers who come to the clinic. That's it. You can't say it applies to any other kind of mothers, right? Okay. So, and then what is response bias? We'll talk about this more too, but response bias is when you have certain people, say you're trying to advertise to bring people into a study, or you describe a study to people and want to recruit them. And certain types of people say, yes, they will participate. What types of people might be more likely to agree to be in a study? What's that? Say it again.
Yeah.
Oh, so if you're trying to recruit people into a study and you're saying, would you like to be in my study? There may be some people who are more likely to say, yes, I would like to be in your study, than no, I don't want to be in your study. How might those people be different? How might the people who say, yes, I want to be in your study, be different than those who say no? What? Oh, question about incentives? Yeah, that's a great point. So some people may be more motivated by an incentive. Who might be more motivated by an incentive?
But if we did more info, know more information about that, so they say yes, and they agree to be our other. Some are here, no one to grant a and that's what's happening. No, maybe internationally, why? Maybe like back house,
Right, okay. So also some people may have more, they might be interested in the information that would come from the study versus others who may not have the same kind of education. You're saying that, yeah, to be interested or curious about that. That's a great point. And also that, and also returning the incentive, who might need an incentive more? People who may be more poor, right? So maybe you end up with more people, and if people are more poor, is their health we might make assumptions about whether their health is what, better or worse than others? Their health might be worse, right? So that could bias your results. No, go ahead.
But the poor people also have more risk.
Yes, yes, exactly. So they may have more risk. At the same time, we also have something called a healthy worker effect, or a healthy effect, where people who are healthy say, yes, I'll volunteer. I'll be a part of your study. And then you end up, and this often happens when we do studies in a workplace, because people who work tend to be healthier than people who don't work, right? They're able to go to work. So it's very difficult to recruit people into your study with no bias at all. You just have to measure many factors in the people who are participating in your study, and when you can, compare them to the general population. So good practice is you have to do two things. One, you have to compare characteristics between your comparison groups, and we'll talk about that in more detail, but so that you know if they're different in any way before you even begin your study, right? Other than the obvious exposure group. And then you should compare who was in your study, general characteristics, age, gender, socioeconomic status, other types of things, with the general population that you are trying to make an inference about. so that you know how the people in your study are different than the population you want to help. Does that make sense? You also see situations where people are particularly interested in a study because they have concerns about that disease or that risk. So maybe I'm more likely to participate in a study about a disease that I think I might have, or an exposure that I think I may have been exposed to, which can also bias the study. That's harder to measure, right? It's a lot harder to measure, but you can ask some questions to help define those factors. You may ask people, why do you want to participate? To get an understanding of whether there may be a little bias.
Questions. Because normally the cohort study, the RTP round. So when we go to enrollment at the site, they will just for checking for the inclusion criteria and exclusion
Yes.
out in interview. So you mean that to compare SPS, it means that we have to have like a baseline or some data, right? Or how to deal with that is the real population that we will go to enroll, or that is the data from the previous study?
Both. So you should do both if you can. It's best practice to any data that you can collect from the people who you have assessed for meeting inclusion criteria. If you can look at that and say, here are the people that we had to exclude from the study, and they are different than our study population we could include on these characteristics, there will be the obvious differences, which is meeting the inclusion criteria, right? But any other differences. And then at the next step, you want to compare the people who qualify for your study and do consent versus those who qualify for your study and do not consent, right? So some people may qualify for your study, they meet the inclusion criteria, and then when you go through the consent form and say, would you like to be a part? Some say no and some say yes, right? So you should compare them as well.
So it's mean that we have to compare one by one in the site, not the enter data in there to computer and analyze.
Later, just you collect the data and then later you can look at the groups and compare those groups. I may have an example here. Let me see if I have this. Share this with you so that you can look, because I would also like to talk about this in randomized controlled trials as well. This was a study, a randomized intervention trial that I ran as when I was still a doctoral student with my advisor who was the PI. But I want to share this flow diagram of how we assessed people for being eligible to the study, and people were excluded. And we categorized those into those who refused to participate, those who weren't eligible. Some were eligible but didn't do this risk assessment. And I'll tell you more about the study, but it's very reasonable because we were capturing people as they were calling in with need for help with social service referrals. So people who couldn't pay their rent, they needed a shelter, housing shelter, food, help with medical care. There's a 3-digit phone number in certain states in the United States, 211, that you can call when you need help with these things, and they'll refer you to services in your area. So we went through and wanted to know, this is a population of people who have a lot of unmet basic needs: food, shelter, clothing. We thought they are probably unlikely to be up to date on cancer prevention and control services. So they probably don't have their mammogram or their HPV vaccine. So we assessed people who called into this hotline for whether they were up to date on cancer prevention and control screenings. And then we, if we included them in the study, we randomized them to 3 different arms of intervention. And we had one control that was basically, we gave them a referral later. And they had different intensity of referrals. But what I want to show you here is that each time there was a group that kind of branches off. So we assessed people if they were eligible. This many were excluded. We want to do a comparison there when we can and see how they're different. 3,719 people completed this risk assessment, but 2,182 were excluded because they either had no risks, so they weren't eligible for any cancer screening, or they didn't want to participate. And then we randomized 1,537 people. And then this is how they were allocated into control group and these other intervention arms. But each time we did that, we wanted to compare, and let me see where I have a we should have. If it's not in this one, it might be in the final, because this one we published after our first follow-up period, 1 and 4 months, but we ended up following up people for 6 months and had a longer term. Let's see. Well, I don't see it. Okay, well, maybe I will look later and see, because I guarantee we did a comparison of who participated and who didn't. I just need to find. I need to find that, but hold on to this because we're gonna talk about this a bit more. I wanted to be able to show you where we compared those who participated and didn't, but it may not be in that paper, so I'll find it. Okay, look at this. We're still on one slide, still on the first slide. I apologize. So determining how to accurately measure the exposure and outcome and ensure the cohort is disease-free. So when we have a cohort study, we need them to be disease-free at the onset of the study, right? Because the whole goal is to see if they develop the disease over time. So we have to make sure that we are properly measuring the disease so that we aren't accidentally including people with the disease in our cohort. And then we have to measure accurately the exposure so we know that we are properly assigning people to exposed or unexposed, right? And this can be information bias or misclassification bias. You think, so many words. Find one with less words. Because I think there's an example down here. All right. And we'll show how that affects the bias as well. Okay, determine which covariates will be important and choose how to measure them. Why do we need to do this? Why do we need to measure not just the exposure and outcome, but anything else we might think are related to the relationship between the exposure and the outcome, or the outcome? Yes, yes. You hear whispers of confounding. Yes. So we want to measure as many things as we can that we think may be related. And how do we know what to measure? What'd you say? Use statistics? What do we know? Well, yes, but also so we did our descriptive study, say, and we found that there were these certain factors that were associated with stunting in our descriptive study. And now we want to see, we're doing a cohort study to see if kids develop stunting. Should we include those factors we measured in our descriptive study? In our cross-sectional study that we saw were associated with stunting?
Include, but we follow is the real or is the negative exposure or relationship or not? This should be included.
So one of them may be the exposure that we're looking at, but also, yes, we should measure all of those, because if we saw that they were associated in a cross-sectional study, we should look at that further and see if in our analytic study, they are associated over time, right? So we want to be able to measure that. Where else might we get information on what cofactors to measure in our cohort study besides exposure and outcome? From our theoretical model, from the literature, right? So we will have done a lit review that tells us, okay, I believe these things are associated with stunting or with the exposure we're interested in. So we need to make sure that we measure these as well, right? So between your model of how you believe your exposure and outcome are related, your lit review of how other people have seen, of factors that other people have measured that are related to these exposures and outcomes, and from any preliminary data that you've collected. That's where you're going to get this list of covariates or other factors that could be confounders that you're going to include, right? You have to make sure you're measuring those properly as well. And then our methods for recruitment and follow-up. So how often are you going to follow up with them? I will tell you, I'll show you this. An RCT, a randomized control trial, is a cohort study. It's just a randomized experiment, but you're still following people over time, right? You can still have lost a follow-up. So in our RCT of treatment conditions, we collected from participants 3 different ways we could contact them. So 3 different phone numbers. And we also asked for 3 people that would know where they were that we could contact if we couldn't get a hold of them. And particularly when you're working with a very low income population who has a lot of unmet needs, their phone number is going to change a lot. In the US, that's the case. Does that happen here? Do people have, yes? So they might have a pay-as-you-go phone, and the phone number may change. So you can't rely on one phone number. You get addresses. You get their mom's phone number and their partner's phone number, or an aunt, anyone that you can think of. So you do that. And we also sent postcards. We sent small little gifts and reminders in the mail. We sent cards on their birthday or on a holiday, anything to keep in mind, hey, we're here and we care about you. And we would really love for you to follow up with us. So, and we had a protocol, which I'll show too, of how you follow up with people. So how many times do you call someone before you consider them lost? How many mailings do you send? And we track all of that, because any kind of cohort study, any kind of follow-up study is useless if you can't follow up with people. And if you lose people, particularly if you lose them differently by the group, by the outcome group, or by their exposure group, or in our case, by treatment group. So you have to have a lot of things in place. And this is to avoid, yes, your loss to follow-up or attrition bias. And as I just said, you have to create these rigorous and thorough study protocols and training program to train observers or interviewers to get the data properly, blinding if that's appropriate, and using standard tools for data collection, making sure you are always recalibrating tools. If you have something like a scale that measures, that can get knocked out of accuracy, you have to recalibrate it. Okay, so that was, I don't know what, like an hour talking about one slide, but it's a very important slide. All right, and I think we've covered a lot of this, so these will move more quickly. But to assemble a cohort, you identify those at risk and exclude people with the prior disease, right? We talked about that. If you have like a rare exposure, occupational or natural exposure. So my examples here are coal miners or people who worked at Chernobyl. So there may be some specific rare exposures. What would be an example of some kind of rare exposure here in Laos? Is there an occupation that is a risk for poor health outcomes, but that isn't very common?
There is a lot of agriculture, and some Chinese they have like the big banana plant, and we put some chemical a lot.
Yeah.
Only 2 or 3 years you should out of something.
Yeah.
So the first.
Okay, so an occupational risk exposure for people working in certain plants or areas where they're exposed to chemicals. So that's common. And that might be that's a good cohort studies are good for these rare exposures. Okay. Case control studies are good for rare outcomes. That's something we'll want to keep in mind. Okay. Cohorts good for rare exposures, and case control for rare outcomes. Okay. So identify those not likely to be lost to follow-up. So again, even though I mentioned that people who are employed may be more likely to be healthy, it's often easier to recruit a cohort of similar people in, say, a specific industry. And you may want to look at that particular industry, this plant where people are being exposed, and see, are there people there who aren't being exposed versus those who are? And then identify those who are able to provide valid and reliable information. We have long cohort studies that have been happening for decades and have now included the children of the original members and the grandchildren. One's called the nurses study, and it was originally a group of nurses who were recruited in the 1990s, I think. Everybody know for sure? I think it was the 1990s, and have been followed ever since, along with their kids and grandkids. And that's because nurses tend to work for a long time. They know things about health, so they're really good reporters. They also, that's going to bias your results a little bit, right? Yes. But when the study authors, the researchers are talking about it, they talk about that and say, we know this is a cohort of nurses, so they are different from people in this way. But nurses in the United States are also more likely to have terrible sleeping habits because they may work night shifts. A lot of them smoke cigarettes, which seems counterintuitive, but it's the stressful life, and that's part of it. Drinking, also with physicians, alcohol abuse can be a problem, in part because physicians and nurses are living they have stressful jobs. But so there are some differences, but they're reliable. So being able to have a reliable group over time. Determining subjects are truly exposed. So here's an example from a cohort study. Using the outpatient medical records, abstractors recorded information on medical conditions, family history of coronary heart disease, that's CHD, and smoking habits. So you can collect data from the person, you can ask them questions, self-report, but also having medical records, having some kind of documentation that's objective, more objective than the person reporting, is important, so that you can be sure about the exposure and the outcome in these individuals. The unexposed should be representative of unexposed members of the whole population from which you're drawing, right? So I think we've talked about this. You want people that represent everyone as best as you can. And then to avoid this exposure misclassification, so accidentally classifying exposed people as unexposed or unexposed people as exposed, you have to be cautious of that. An example here is you accidentally put a malnourished person into an adequately nourished category. How is that going to affect your outcome? Say you're looking at something that's related to malnourishment, like stunting. If you accidentally put malnourished people into the adequately healthy, nourished group, and you're looking for who develops stunting over time, what's going to happen? I have a slide for this, but so you have malnourished, and we'll just say healthy. I know that's not the same. Adequately nourished. But what you do is accidentally put a bunch of these people into this group, and then you follow for the outcomes. Where are you going to see, so we'll say this is stunted, not stunted. What are you going to see here in this you've accidentally put a bunch of malnourished people in the healthy category. Which of these outcomes are you gonna end up seeing more of here, potentially? If you put malnourished children in the healthy group, are you gonna see more here or here? More here. So you might end up having this be, we'll pretend that this line is the weight of how many people are in this group, right? And it may be that you've accidentally put healthy people here, or this is still malnourished. So you have, you know, more people stunted in both. What's that going to do to your measure of association? Nilupa, might need your eyes here for a second. If you have I know I have a slide for this too, we'll look. But if you end up with more of the outcome in the group of people you expected to not have the outcome, then that's going to bias your results towards the null.
Bad when you want.
Oh, I'm sorry. Yes.
My eyes have to get closer.
That's gonna bias your results towards the null, right? Like, so you've misclassified, you've accidentally put a bunch of malnourished people in the healthy category of exposure. So now your healthy category has a lot of stunted and your unhealthy category has a lot of stunted. So the difference between these is gonna be smaller.
Yeah, it's smaller and the some one question is in the when you put the healthy in the malnourished group, but why the outcome the outcome to be as the same as the unhealthy group?
Yeah, it may not be, it may be not as much, right? Maybe just a little more, but it's still gonna mean that this difference is small. Yes, thank you, is narrower. It's smaller than you would expect. Because you might, let's just say that the, you know, that you expect this to be, if people are malnourished, they're like 5, you know, stunted. 50%?
I'm
Sure.
It's a very large number.
Yes, exactly. I mean, this is huge.
Yeah.
And maybe you expected this to be closer to 20. But because of this misclassification, you ended up with 35%. So you thought your difference was going to be this, and you probably powered your study on that too. But what you found is you're actually getting this difference. So the difference is narrower. This is one of the worst kinds of bias you can get, because it's really going to you're just gonna go like, oh. Because it messes up your whole, it messes up your study. Now, if you could identify who those people were, I don't know, I've never had an opportunity where you've tried to change your misclassification, but I assume you could do that in the end, or you may just have to exclude them if you identify who you've misclassified.
I'm trying to think of Kathmanee has a nice example, I think. You can see her now. Because Kathmanee did a study of adolescents who have internet and adolescents who don't have internet. And that's the exposure, kind of, the predictor exposure. And we want to look at food preference. And we want to compare these two groups. But it turned out that some of these that we thought had no internet, actually they had internet. So that's a misclassification of the exposure. And so sometimes you have the opportunity, because she chase those adolescents to ask, did you really have internet? Can you and then she can try to make some correction, but not all the time. Sometimes it's possible, sometimes it's not possible, but there she had the opportunity to try and correctly classify. But most of the time it's not possible, I think, because you interview them or you take a measurement and then you can't take a measurement again. Sometimes you realize the problem like 6 months later,
Yes.
and then it's like too late.
Or you can't change, if you have an intervention trial, you can't change their intervention.
Yes.
You just can't. So, yeah.
Yeah, I know this mostly from our CT where, for example, you give intervention, like maybe it's like social behavior change, and you give standard of care, like no intervention. And then, so it's a behavior change. So you give information, you give messages, and then these people talk to those people. And then suddenly these people are like intervention. So they're sort of over here, but they were supposed to be over here.
Yeah.
So that it always reduces that
Bleeds
effect.
out.
So the differences between the two groups becomes less, they come closer together. So now it's a small difference in the outcome.
And you may not be able to statistically show the difference that you thought was going to exist, right?
I have a question.
Yes.
In this case, if, for example, if we know that we only include the disease, maybe the group that have malnutrition in healthy population, maybe 6 months later, can we include more the healthy one that don't have any intervention?
Can you include more in the healthy to sort of wash it out?
Yes.
No, I don't think you can. Now, you might be able to, depending on when you discover the mistake and how long your follow-up is, you may be able to take the malnourished from the healthy and put them back in the malnourished exposed group. But you can't add more to the healthy to kind of dilute the effects.
Because I think the healthy is one part of the control group, right? That we not adding anything from them to them.
Right, well, and this is a cohort, so we're not doing any intervention or treatment, it's just exposed and unexposed. So, yeah, we haven't done anything with them, but we want to make sure we're capturing people exactly the same way. So we don't want to suddenly bring more individuals into this group. If it's still during your recruitment period, there's maybe, and still not adding to this, but you still may be able to move people if you figured out that you've misclassified them.
I can think of like at least 3 things. So one, you have IRB. So adding more people, you need the permission of IRB. 2, you have a donor and a budget. So then you need to go and explain why you need 100 more people because, and when these groups will always ask you like, okay, you misclassified, what happened? How did it happen? How are you going to fix and prevent the problem in the future? Like, so it's not a simple, it's not like I can just take 100 more.
Yeah.
And then balance like.
And it's a reporting, you have to report to your monitoring, your IRB and your monitoring board. You have to say, I did this wrong.
Yeah,
And
everything has to be reported.
Anything that happens that has occurred that is contrary to how you intended and is written in your IRB protocol has to be reported.
And you might have a public, remember we talked about public registering of clinical trials? Like then you have to register, so you had a sample size of 2,000, now you want 2,100. Like you have to explain, so that has to be publicly, everything has to be very transparent.
Adding is very, very.
And it can be messy because you might keep making the same mistake, right?
So in the calculation for 20% of our follow-up, right? So if this case is not more than 20, we can cut that off, right? Or so how you know that this amount of people is not the good, not the correct group.
Well, here's what you do, is you just have to report the results that you got. You have to report it this way, and then in your discussion and in your results, you say, we misclassified these individuals. And so we believe that our results are biased towards the null, or that we didn't see the effect that we predicted because we accidentally misclassified. But you can't really go back and change it. So that's why you have to be so cautious in your planning.
I mean, these two include into the analysis or not?
Yes.
Oh, yeah.
There not exist 20% of the loss to loss.
Okay,
Yes,
so
there
first of
is-
all, can I
oh.
just say this 20% loss to follow-up? So what you're saying is that you do a sample size calculation and then you add something because you know some people will fall out. And then so your true one is like something plus 10% more. So 20% is a lot, but 10% you increase by a little bit. But that is then your sample size. Like it builds into the assumption you will lose 10% because withdrawing and something like that. But you can't say like, oh, this is a thing, I can have this number or this number. No, you said this number, that is your number. Everybody expects you to have that number. Like you can't say, oh, I had a 10%, 20%, I'm free to do whatever. No.
And
If
you
you put
must,
that number, that is the expectation. So you don't have any flexibility. You have to be just open and say that. And sometimes you never know. Like,
yeah,
for example, if this is like inadequate intake of vitamin A, right? You measure using 24-hour recall. There's so much measurement error.
Yeah.
So it's very easy to misclassify and you will never know, right? Because you can't go back to that day and get the dietary recall from 6 months ago. It's just error. So,
Yeah.
so this is just built in to the whole system.
and don't spend the resources doing a cohort study without having the best possible means of measurement that you can for classifying your exposed and unexposed and your disease. Because you don't want to go through this and have so much kind of washout between these that you're not going to find the effect that you want, because your version, your way of measuring, you have to find a different way or multiple ways. I don't know anything about vitamin A measurement. If you had maybe 3 different ways you could measure vitamin A intake, use those, use all 3. Don't use just one to classify people. Because you don't want to take the risk of misclassifying, of having this like incredible, well-planned study where you're going to follow people and you're going to commit a year of your life to this. Or, I mean, in the United States, an R01 where we do any kind of follow, like that's the funding mechanism often used to do follow-up. It's 5 years. It's a 5-year study. You spend a year planning. You usually spend 2 years in data collection. And then you give yourself a wiggle room and then have a year of like writing up the results. But it's 5 years of your life. You want to plan as much as you can on the front end, have all those protocols in place, have other people review it, have the IRB approve it, have someone else say, wait, you're only measuring vitamin A intake is your exposure and you're only measuring it with this one thing. You've got to measure it multiple ways to be sure.
Or something quite rigorous. And there's another special case for RCT. So remember, like if you give like supplements versus no supplement, right? And maybe this one
Yeah.
Yeah, and then that means like you can try to fix, but then when you fix things, you can break things too. So it's a little bit broken, you keep with it. And what happens, that bias that she's talking about, this difference that gets smaller and smaller, it means that you're more likely to keep the null hypothesis, right? And that's what conservative means. It's you want to kind of, if you make any kind of mistake, type 1 or type 2, you want to kind of make the mistake of like losing power, not detecting something.
Yes. Yes.
Remember, in almost all cases, we prefer a type 2 error to a type 1 error. This is going to be a type 2 error.
And also, if you're having a RCT and people aren't being adherent to their taking it, you need to measure why. Because those are important confounders that are happening. Why isn't this person taking it? Do they not have access to, something? Is there other stuff in their life going on?
Because it affects your generalizability.
Yeah, yes. Adherent is one of my least favorite words. I mean, I know you like it, that's the
the
correct term, it's the technical term in intervention. But yeah, there's, yeah. Good, okay. All right. So then this loss to follow up is, as I mentioned, is a primary bias in cohort. And if it differs by exposure status, you have people, in this, you may lose way more of your exposed from the study, because maybe if they're malnourished, they're going to be more likely to get other illnesses, right? Or not be able to participate in the follow-up. Maybe you have your follow-up at a clinic and they can't get there. So you may have differential loss to follow-up also based on exposure status. So anyway, here's, yes, examples of like the ways to keep track of study participants. So what time is our break? 10:30?
10:45.
10:45. Okay. All right. So here's what I'm going to go through. We've done and then the selection bias, as we mentioned, that's when the people who are in the study are different in the sample compared to the population. We discussed that. Trying to just go, because I think we've talked about most of these just without having a slide up there. Controlling for all of these bias is to use these standard tools, the definitions, the markers of exposure, measuring and understand those who participate and don't, follow up, and don't overburden participants. This is also really important, that you don't ask too much of participants. If you want them to fill out a 24-hour food recall, like every day for 6 months, no way. You're never going to be able to keep those people in a study. Of course, you could do it once a week, or I don't, again, this is not my area, so I'm making things up when I say food frequency questionnaire once a week. But their interaction, the burden that has to be put on the participant should be as minimal as possible. And as I mentioned, like sending those birthday cards and things, creating this bond or feeling of belonging. And we would send out like magnets that had the logo of the study that they could put that would frame, say, a photo that they could put on their refrigerator, just anything. We had these, we had somebody who made custom-made cookies. Those were actually for our interviewers, for our recruiters, because they worked at this social service hotline. So every month we would go and tell them how well they've done in their recruiting, and bring them these cookies and kind of celebrate. It's so important to make people feel a part of the study. When I worked on a study in Appalachian, Kentucky, which is an area of the United States that's very poor, it's the poorest part of, one of the poorest parts of the country, has some of the worst health outcomes, is geographically difficult to get to. And I worked with nurses who lived there. They collected the data. And so every once in a while, I would bring them things from, the city that they loved. I'd go to the mall and get a couple of things that I knew they really liked. And I would bring them to them and say, thank you. Thank you for doing this work. And thank you for being great data collectors, because it's important to keep people engaged and valued so that they'll continue to do the good work. Okay, so we'll talk for a moment about these measures of association. Yes, our cumulative incidence, which is risk, and you find that in a fixed cohort. Okay, so a fixed cohort means you're following the same people from the beginning to the end. Your population is closed. You have your study participants, say it's 2,000 people. You plan to follow the same 2,000 people from beginning to end. You have incidence density or a rate when you have a dynamic cohort. So that is when, like whom you were asking, when people get sick and then they may get better, or if you have a closed population, like I think cruise ship is always a good example for people. I would never in my life ever go on a cruise. There are, from the United States, like everybody gets some horrible gastrointestinal disease. It just sounds miserable. But you may have a population like this where some people are getting sick and then getting better, and then they become part of the susceptible population again. They might be. So a dynamic cohort is usually people kind of come in and out. And if we look at our exposure and outcome, right? Outcome in columns, exposure in rows. I know this is different than maybe Roger showed you. And Nilupa, do you do? So epidemiology, we usually do it with the outcome as the columns and the exposure as the rows. It's okay when you do it different ways. You just have to know how you're flipping around your odds ratios, but really it's always going to be, well, Nilupa and I may differ on this, but you're, A times D over B times C. So let me show you. So the cumulative incidence or the risk among the exposed is A, those who are exposed and have the outcome out of everyone who is exposed. So it's the risk of the outcome among all who are exposed. Yeah? And then for the unexposed, the cumulative incidence or risk of the outcome among the unexposed is C. So you have not been exposed, but you have the outcome over everyone who was not exposed. Does this make sense? Okay, so everyone, no, Nilupa has a face. What? Oh, you transposed saying like the. So, it's, yeah, so when you're looking at this in cohorts, usually you look at the cumulative incidence of the outcome among the exposed over the cumulative incidence of the outcome among the unexposed. Okay. And this assumes follow-up time because we're calling this risk. It's the risk of the outcome among the unexposed compared to the risk of the outcome among the exposed versus the risk of the outcome among the unexposed. Yeah. Mm-hmm.
Because sometimes I feel like I don't know all these words very well. So risk doesn't have a time limit.
This is just the cumulative incidence, which is just in a fixed period of time. just the,
Whatever your study duration. is.
whatever your study
Or
duration is.
Observation period, which could
Yeah.
vary from person to person, but it's whatever it is.
No, this is only in a fixed cohort where everybody's
Start,
time in the study is the same.
but do they start at the same time?
Yes,
They have to start exactly at the same time? You don't
yeah.
rolling enrollment?
No, this is, well, they're unexposed, they don't have disease at the, well, okay, so everyone's time in the study is the same. So even if,
Everybody has 6 months, but they get enrolled in January or February or March.
that could be, yes, exactly, but everybody's time in the study is 6 months. Right? So that incidence, when the disease occurs during this fixed period of time, the fixed period of time is the same for everyone. That is called cumulative incidence, and that can be described as risk. When you have people entering and exiting, as Nalupa said, maybe you have people are contributing, then we'll talk about this, but person time to a total, then you call that a rate. It's a incidence rate. And that's different than risk, the risk.
So it's right, just you be to one group, or total population, no comparison.
For-
Look at the overall incidence over a period of time of total population.
It's, yeah, so it's when we're looking at a dynamic cohort, so a cohort that might change over a period of time. But each person's time in it may be different. So somebody may be in this for 2 weeks and somebody else might be in it for 6 months. If the total time you're looking at maybe a year, but some people are coming in and out of the population, that's the rate. And I'm going to show you that.
So the top each one will be public.
Yes, so you account for each person's time. I'll have a set of slides that are going to show that, and we'll be able to do the math and show you where people are coming in and out of the cohort. It's a little bit easier. But this risk, when you're looking at cumulative incidence or risk, it's a fixed period of time for each person. So do they develop it in this period of time? That is the incidence or the risk. The risk of developing the outcome.
So we have to report a period of time too.
It's the study period. Yeah, it'll be reported. I'll show you, because the denominator will be different.
Studying our observation and it's at any point of the time.
Yes,
It's
right. Yes, I'll show you when this, but the denominator will be different because we'll use person time, like 10,000 person years, because each person contributes a different amount of time. Whereas in a fixed cohort study, everyone is there for the same period of time. Most of what you're doing is a fixed cohort. Most of the work that you'll be doing. Typically, we're using the incidence rate in periods of outbreaks. That's the most common time you're going to see it, like in a specific outbreak. But I'll show you those examples. Let's see. So, but what this is, it's a ratio, right? Your relative risk. It's the risk of developing the outcome in the exposed over the risk of developing the outcome in the unexposed group over this specific period of time. Okay, it's the strength, it measures the strength of the exposure disease relationship. And so we take this cumulative incidence of the exposed, cumulative incidence of the outcome in the exposed, and divide it by the cumulative incidence of the outcome in the unexposed. And the hypothesis that you would use for a relative risk, the null is 1, right? Why? Let's say your risk of developing lung cancer, just use that, the cumulative incidence of those of lung cancer among smokers is we'll just have like, let's see, we'll go with whatever, we'll just say 5, right? Okay, and then imagine the cumulative incidence, basically the number of cases of lung cancer in the unexposed group, people who don't smoke. Let's say that was also 5 in this group of people you have. What does this give you? 1. So what does 1 mean here?
No, risk. One is not different.
No difference. Yes. So unlike other measures that we might use where the null value is 0, the null value in relative risk is 1, because 1 means they're the same. There's no difference, right? So the null hypothesis is that the risk is the same, or the incidence risks of disease in the exposed and unexposed populations are the same. That is, there's no association between exposure and disease status based on the data presented in the study. There's no difference in how many people are developing the outcome in the exposed versus the unexposed. Our alternative hypothesis then is that it doesn't equal 1. It's anything other than 1, right? There is some difference. Usually we're going to have an idea of which direction that difference is. If we're talking about the smokers, what would we anticipate if the incidence of smoking is 5 out of 100 people in our I'm sorry, the incidence of lung cancer in our smokers, might we expect it to be in our non-smokers? Do we think non-smokers are going to have more or fewer cases of lung cancer? Fewer? Yeah. So maybe we could say 2. Okay, and then what's our? Someone can do the actual. What would it be? What's 5 divided by 2 in decimals?
2.5.
3.5? Oh, thanks. Yeah. There we go. 2.5. So what would we say? The relative risk of lung cancer. Hold on. Let me show you. The risk of lung cancer, okay, disease in smokers was 2.5 times greater than the risk of lung cancer in non-smokers. Okay? In relative risk, you can say, if you're using the relative risk, you can say times greater or times lower. This is one of the few examples when you can use that phrasing. We'll talk about that. You know, you can't say more likely. Just strike the words more likely from your vocabulary when you're talking about disease outcomes. We say that the risk is greater or lower. We may say the odds are higher or lower, but we almost never say something is more likely. Nulupa, what's a statistical When can we statistically say something's more likely? I just never do it
Oh,
because it's not the proper way of describing something.
yeah.
Like, oh, you're more like, sure, you could say you're more likely to get lung cancer if you're a smoker. But the proper way of saying it is that the risk of lung cancer among smokers is 2.5 times greater than the risk of lung cancer among non-smokers. Always write these. I used to keep, go ahead.
Can you, I mean, if you have to communicate to people, like not technical people, just other people, normal people, would you say more likely? Or it would say 2.5 times more likely?
You could say 2.5 times. Well, because then you're talking about likelihood. But yes, I see what you're saying. I just might say you have a 2.5 times greater risk. You have a much higher risk. You could say that. Because any individual is not necessarily more likely, right? You have a higher risk. It's a very, it seems like a subtle difference, but it's a more accurate way of communicating risk and of disease, right? Than saying, well, you're more likely to get this if, but you could say your risk is greater.
Or you are at risk.
Yeah.
Well, everybody's at risk for everything, right? And
You're at greater risk, yeah.
for most things, right? Like,
Yeah.
I will not get prostate cancer, but you know, like, but everything else, yes, like, but it's how much more, yeah, so my risk for something might be less than your risk.
Yeah, unless you're doing like,
2.5 times the risk if we do this thing.
when do you use a likelihood ratio? If you're using a likelihood ratio, you can say likely. But
Once. This is where like the statistician, like the.
statisticians don't care, but epidemiologists do.
What's the
Maybe.
difference between probability and risk? Is it the same thing?
Well, that's a good question because this is like a probability, right? But the rate is, when we talk about rate, incident rate, that's different.
Okay.
It's occurrence over time. So we try not to say, that's exactly, I think, too, why we try to avoid likelihood, because that's more associated with probability and it could be more appropriate, but if you just stick to the proper way of expressing this, you're prevented from saying the wrong thing. I cringe whenever I hear, when someone describes an odds ratio as someone being like twice as likely. No, that's not right. That's not right. Your odds are 2 times higher. So you do need to be, I think, cautious about how you describe, because we're already terrible as humans at understanding risk. We're so bad at it and putting it in context of our lives. So the least we can do is try to be cautious about how we communicate risk to others. Oh, yes, this is the other one that some people will say, okay, if our risk ratio is 2.5, you could say risk in group A is 150% higher than the risk in group B. And you can do that. So you can express it as a percent of change. But these are the only 2 ways I would recommend describing this. Let us.
Like, it's also like, there's communication to the general public, but like, we're talking here about research. And in research, you have to be so precise. And so like, I really like your formula of how to write the sentence.
Yes,
That's very
I do this for everything. And I used to always have like a little cheat sheet that I kept pinned up behind my desk that just, I had all of my interpretations for relative risk, for odds ratios, for everything. So that when I came time to write it, I made sure I was writing it properly. So yes, I recommend doing that. And I think I'll ask Kelly, I think at some point, maybe during module 7 before, I have like a cheat sheet of choosing statistical tests, but on the flip side of that, we could put some of these interpretations. But let's take a break. Yeah, this is a lot for the morning. So take, what, 15 minutes or so? Yeah. Your risk of falling asleep in the exposed group of being in this room is like 10 times greater than the risk of falling asleep of people who go out and take a break.
Just, I wanted to do a small data collection in a paper-based way. So don't write your name on this card. I just want you to answer 4 questions. And so these are the 4 questions. I don't know if you want to, if these are clear questions. So the first 2 questions are on a scale 1 to 7. How important is this thing, right? So I just want to understand more. Many of you come from different kind of institutions and you have different priorities and different job responsibilities. Kelly, can I ask you, just to be very, like, are these questions clear, or is it worth some discussion of the 1 to 7 scale and so on?
So everybody know what institution means in this case? So we have Dondo, we have UHS, we have Lao institution.
Your workplace.
Yeah, your workplace.
So how important is the research in your workplace? And it's from really not important to like very, very, very important. And just put a number.
So yeah, so 7 is the highest, yeah? 7 is 100% most important, completely important.
So on your card, I would just say, don't put your name. I don't need names, just anonymous. Just write like Q1. I don't know. I think it's, 5 or something, maybe Q2. Okay, for me, research is not very important. So maybe I say 2 and like that. So Q3 and Q4. Q3 is a number. Yeah, go ahead.
Number 3 is percentage. So bottom up and
30%. And then problem is, I don't know, students, too much students or something like that. So you can write whatever you like for the last one. If you have any if you have no challenge, say, okay, nothing serious. But if you have some kind of challenge in doing research, personally speaking, things that you.
challenge for you, not for Laos. But for you.
Yeah.
Sông khóc mẹ đi mai là mẹ gia đình cha được con từ thế này sẽ không có gì. Ở đây có cái gì đó. Đó đi khung được qua sang đi mai cho nên là cái người ta khen. Thì mình đem lại luôn. Quân này thì của mình mà để làm gì. Có người ta hay mà đâu đi mà là không phải nương ở đây để như là có tại sao nó gì thì phải cũng là nó đây ra một tí của các mẹ nhiều nó rất nhiều mình có những của đâu phải mình không bỏ có để không chỉ của xôm
những bộ cái gì cái sao luôn phải là cái nào luôn tôi đi đây.
So, where is everybody?
I'm assuming because we left it.
15, maybe they were just waiting an hour.
I'm a speed and then not 50.
Thank you. Okay, I took, I'm sorry. I took 15 more minutes. But
So when you have class, do you always start at a variable time or do you start on time?
all the.
You're what? It's a moving,
Exactly on.
What did you do, to, you had a special method that I didn't know. To duplicate display? Window and P, okay. Just go on.
Yeah. I brought all of my. Adapters and converters. And people do those nearby, right, yeah, yes, and Japan too, I didn't realize Japan does the same.
Like like US type?
So, I mean, so you can use, yeah. So the whole trip, I probably didn't maybe write anything.
Yeah,
You know, but the converter's nice. 'Cause you know, a little different.
I think I should just start with who is here because we'll spend a little bit of time on this and then people will come and then we'll get like deep into like religious, which I want everybody to hear, whereas this will be like a little more. So did anyone get a chance to look at these two papers? A little bit. Yeah? Kind of. Can you like just, the papers have so much detail, so it's nice to just understand the big picture, right, without going to the fine detail. Can anyone like just explain like the argument, like what is the issue? What is the controversy? Not, controversy is maybe too big a word, like what is the debate? Or discussion about?
Talking about, so then we try to eliminate food, security, the hunger, people have a lot of food and keep long time to be processed food, but that processed food is also not good for health.
Yeah, that is a good summary, that there are some good aspects of these kinds of food. And there are some negative concerns, right? And how do people know there's a negative concern? Like, how do you know, is there any evidence or like, why do people think that processed food is not healthy?
Because of the trauma for eating can measure by the BMI of the people, while over BMI or low BMI. So if over is like a true problem of health to identify.
Yeah. So
Processed food is the food that add some substance to the food to keep long time. And also add some seasoning that for the pastel and salt, sugar or MSG, and also
preservatives, oil,
yes, fat. It's really the family food. For long time, that's all, and a lot of
Fish sauce and fermented fish and soybeans and things like that. Yeah, so one of the challenges is that there is categorization, right? How much processing food is.
And I think last time, a few days ago when we talked about this NOVA classification. And I think you got the slides, right? So you can make this big. You have this one? Yeah, because I know it's too small to read, but basically there's these different categories. And actually not different, there's 4 categories of processed foods. No, that's not good. Hang on, 1 second. Let me see if I can just try to make it big. So we can kind of see it's a little bit better. These categories go from like no processing to a little bit processing to like, and so processing of food is just, it's a process of the food, like whether it's boiling or fermenting or canning or freezing, or, you know, it's like a thing that you do to the food. But then in this category, especially of ultra processed, so let me show that. It's not only the processing that is in this category. Let me make that as big as I can. It's a little bit blurry, but there is. But again, if you look at the link that is in here, the website is from FAO, and you can get the whole PDF and then see it. But so it's the things you do to the food that is the processing, the making flour, fermentation, everything like that. There's a whole range of things you can do to food. But then there's additional things. And for example, you can add the preservative, or you can add, you know, artificial color or some extra flavor. Or you can add salt or MSG or sugar, lots, you know. So then there's the addition of things. Then there is you know, so some of these things, which is not necessarily like the processing itself, right? So there's addition of things. What else? There is a lot of effort to kind of change food so that it is more appealing. Right? In the US, this is definitely true, and I think this is true in the whole world. There's a whole industry where if you study food science, you can get this job where literally you try to design, you know, snacks or food so that people want to eat them. You know, that it's like very tasty, nice and crunchy, like it has sensory characteristics that make you want to eat more. And that's the job, they have to sell food, right? And make money. And so there's a whole science behind that of why people eat and how to make people eat more, how to do marketing, so it's appealing, so packaging and so on. So there's this classification system is not very specific. This last category of ultra processed is very big, and it can include some good things and some bad things. So I think you mentioned one, maybe something that was shelf life. So you can have food that's spoiling, right? And by adding some preservatives, you can prevent food waste. You can prevent contamination of the food, right? Like it spoils or becomes, you know, contaminated with bacteria or something like that. So food safety can be improved as well. So there are some positive things. And these things can be helpful. For example, if you have food insecurity and you want to preserve the food for longer, for a food insecure population, this could be good, right? And if you can do something like vegetables where you can, you know, do canning or, you know, save vegetables for later, then in the time when you don't have vegetables are very expensive, if you have that kind of food that is saved, it's beneficial. So there are some positives and some negatives, and that's also part of the argument. So one of the challenges that comes up in this and part of the debate is this classification system, is it adequate for our purposes? Or do we need a better classification system? And if so, how do we? There's another issue which I think who was saying, I think it
was here in so ultra processed foods can affect BMI. What kind of study design is used to kind of make that statement? Really? Not really. RCT means that I take all of you and I tell you, and Dr. Anthony needs to eat potato chips and your control, and your potato chips and your control, and you eat for 6 months and then I measure your BMI. I mean, people don't do studies like that. In fact, it's a little bit, is it ethical? I don't know. Like to say you have to eat potato chips for 6 months. Right. So it's more of these epidemiological study designs that are not RCTs. And so if you do something like cross-sectional, even if you do cohort, what can you say about causality? Can you say if you do cross-sectional, people who eat potato chips have high BMI? So does that mean potato chip is high BMI?
You say that they have, but it doesn't mean it makes.
Right. Yeah.
Sorry.
Yeah, exactly. So the causality, it's, so now, for example, we said sometimes RCTs are not possible, right? If you have smoking, you can't do RCT. You can't ask people to smoke cigarettes, right? And for food, it's a little bit better, but it's still a little bit, ethics is a little bit questionable. Can you tell people to eat ultra processed foods and then we see what happens? Probably that's not gonna go either, right? So is it okay? Is it okay if we just have this epidemiological type of study design? Do you think that that's enough evidence or no? Yeah, you're not very, but then, okay, but so what will convince you? If you say that I don't like this study design does not convince me that this type of food is increasing BMI, then what is going to convince you? Or either positively or negatively, what kind of evidence do you want to be more reassured that there's a causal effect?
For me, I think when we select the case like overweight or obesity, and we look at that and identify who BMI overweight or obesity, and this better they look back case.
Yes.
Yeah, and it's maybe we didn't want to give them and follow up or something, but they got already that we asked retrospective to identify.
Case control.
Yeah, retrospective. Yeah, but then is that enough evidence for you?
No.
Like if so here you take overweight people and normal weight people and you say, well, these people ate this last week, last month, last year. Yeah,
I think for something like this, we can assign them to eat something which is not good for them for sure. And or even we start from the outcome and look back to the exposure, there might be some other confounders. But if we look at several studies at the same time, and we found a consistent of evidence from several study and for many years, like systematic review of a certain type of study, there might be another step of deciding to believe or not.
So if I do a association kind of study, cross-sectional or cohort or retrospective, like case control, you're saying if I see one, you're not convinced. But if you do the same study design many times, you feel more convinced?
More, for sure.
For sure?
More? Yeah, for me.
But it's still really just the associations cannot prove for the causality. Even you give it to the same designs of the study, but you cannot prove it that is the causality.
Right.
No, I mean, in the level of convince, yeah, it would be more. But better than looking at one study,
Mm.
and regarding the course of the disease, of the cause of the problem, you might need more than one thing to look at.
Hmm.
And this is the only thing that we look at. This is consistency of evidence.
So I think if we do a systematic review or meta analysis that every country have the same result, that
Same
can
idea.
be more strong in doing this constitutional study.
So you're seeing that kind of association across different contexts,
Yes.
different population, different countries, different environments. So that will be a little more convincing, even though the study design still is not strong enough to really, like if it were randomized, I think, like we feel fairly like we have more confidence. But even then, it's not, necessarily, is there something besides study design that will help make a case? Like that, and one of the papers was trying to do this, actually.
Laboratory.
You can do laboratory, yes, so explain, what do you mean laboratory?
Laboratory. I studied the mechanism of. I don't know. To be more valid or strong in consistency. To see something that might the absorption and transformation of the nutrient into. Yeah.
Right,
It's
so
really
I think you said the one like really useful word is mechanism. Right, so when you have an association, right, and it's a cohort study or even cross-sectional or cohort, maybe even a really good cohort, maybe it's like multiple cohort. Like, but you're still like, it's still people are choosing what they eat, right? Like no matter, even if you have 1 million people and they're still making the choice. So the people who choose to eat ultra processed foods are different from the people who don't eat.
How about
Right.
choosing the mouse rather than people?
Yes,
The animal
so you can do,
experiment.
yes, so maybe you say, I can't do a randomized trial with people, it's not ethical, but I'm okay if it's a mouse study. So if it's an animal study, then you give a standard diet, and here you give a standard diet with more ultra processing. And then you can look at weight gain in the two. You can look at, but there's another part, even with humans or even with mice, you have to think about the mechanism. Everything we do with kind of more health related human research, there's a long mechanism. And that's why that one of the papers, that Valicente paper, that's very long, it's extremely detailed, right? Because, and the reason why is they say, okay, you eat this food, or they're not even that you eat. The first paper that's a bit short, it's like an editorial or opinion. It's saying that in the last, 50 years or something, we have more ultra processed foods, and we have more obesity. And we know the food system is changing, and these foods are available, and everybody is gaining more body weight in every country and so on. But it's really just it's almost ecological, right? Like it's saying, this is happening, these two must be connected, right? But there's a lot in between, so ultra processed foods are now available, right? What is the pathway that this food if I go to the shops, the food is there. How do you connect the availability of that food to my body weight, right? Does it mean that I buy more? Does it mean that I truly eat more? Does it mean that my total caloric intake is greater? Is there something about this food that makes me want to eat more and more and more, right? So they kind of divided, I have my notes, so I have to look. Actually, let me look in the paper itself. Let me look at this one here. This. So here's the, just looking at the abstract, and it said there are some possible mechanisms. Right? So and we can look at the things that are available. So what is it? Is it the content of the food? Is it because the fiber content or the texture, the feeling, in the mouth, that the digestion of that food, it's easy to digest. So you can look at, how long does it stay in your stomach? How quickly does it move through the intestine? Is it those characteristics of the food that make you eat more and make you absorb more nutrients and more energy? And that is the reason why my body weight is gaining? Or is it something else? Like, is it because, it makes me hungry? So it's an appetite. Like I feel like I want to eat more when I eat this. Maybe it affects my blood sugar and then I eat more because I feel my blood sugar is fluctuating too much, then I'm feeling like I need to eat. So maybe that's the mechanism. And so what it does is that it looks at different kinds of mechanisms. Let me consult my notes because I made better notes. So one possible mechanism is that it affects food choices, right? That there is something, maybe it's the marketing, maybe it's the characteristics of the food, the sensory characteristics, the taste, the feeling, the texture, what else in food choice? The cost, maybe it's low cost, and that's why I'm eating it because it's much cheaper than, more healthy food. So maybe that's why I'm eating. So that's one mechanism, is like it's changing the choices people are making about food, right? Another possible mechanism is that there's something about like the composition of the food, right? It adds salt, it adds sugar, people like it, so is it something like that? The energy density is different. There's some additives, the preservatives, other kinds of things that affect people's behavior. And then there's the digestive aspect, right? So that is how fast you eat, the digestion in the stomach, the digestion in the intestine, and so on. So there's like different kinds of mechanisms that they hypothesize that connects the food in the store to your body mass. And so then what they did was they went for each one and said, what is the evidence? Did anybody look at whether, having this kind of price is going to affect the quantity eaten? Has there been any study like that? And then is it like a cross-sectional? Is it an experiment? Because that you can do an experiment, right? You can offer people like, here, you can have this drink for this price or that price. And then you can randomize and see how much people buy and how much people eat and drink and so that is possible. But maybe they did this study, maybe they didn't. And so what they did is look at different mechanisms and then say, what's the evidence? Did anybody do a study? And if they did a study, did they do kind of epidemiological kind of study? Did they do randomized study? What did they find? Did they do something with very small sample size? Did they do a big one? So you can kind of assess the evidence for all of those arguments and then say like, well, okay, how do we know? Do we make the connection? This is really, the idea of mechanism is really important because if you think, so for example, some of you might have, I gave one of the ANRCB seminars that is once a month. I gave a case where we worked with community health workers and we were trying to improve kind of the parenting behavior of families. So we worked with mothers and fathers and the health workers trying to train mothers and fathers about, better ways to do things with their baby. And what we did was we measured child diet, we measured anthropometry, things like that. Community health workers talking to a mother or a father is very far from, a child nutritional status, right? You have to talk to the parents have to understand you. They have to have the ability to do the change. They have to have the motivation to do the change. They have many barriers at home they have to overcome, make a change. That has to affect the baby so that you see maybe a change in diet. So you can measure a change in nutritional status, which has to do a lot with metabolism and infection. Like, it's a very long pathway, right? And even if you do an RCT, like, are you convinced that this mechanism is really working? Right? Because many things can go wrong, and you should probably measure those things and establish the mechanism. So a mechanism can be a very good way to say that there is some relationship. Especially if you can't do an RCT.
What do you think?
Does it make?
What is the question again?
No, it's not a question. It's just saying that so one way to look at causality is to say, what are the mechanisms, and do I have evidence for those mechanisms? Right? If I do a knowledge intervention with families, did their knowledge truly increase? Did their motivation increase? Did their behavior change? If these things didn't happen and the baby is like doing better, I mean, it's good the baby is doing better, but it's not because of you. Because you didn't change knowledge, you didn't change behavior. Like, if you change an outcome, it's probably not you. Maybe they went to the clinic or had a good, some other intervention or some other health promotion. So it's not your work that did the result, right? So I think that is important to be asking those questions as well.
To be sure of the cause, what should be focused on?
To be sure what?
With the cause of a problem.
The cause, it's the causality.
Especially.
You have to decide yourself.
Yeah.
Because, like, for example, like, even Kate and I, we were, debating, like, okay, is RCT enough to talk about causality? Do you want more? Or, most people would say, like, okay, you have to at least have something like an RCT. But I think Kate would say, like, okay, but that's not enough. What else? Is there a mechanism? Maybe you do a randomized trial, you see results.
Evidence.
When it's, something like this is, like, it's so messy. There are so many things going on. It's difficult to measure everything and to know where in the process to measure. This paper tries. Like I said to Luke, I was like, it's very thorough. It talks about a lot of mechanisms, but what are the interactions between some of these mechanisms depending on the person? Or, but I think this is just a really challenging cause and effect relationship to try to measure. But in other cases, yes, there are, and we'll talk hopefully tomorrow about some of the Hill criteria or the causal, which are, loose guidelines, but yeah, there are a lot of different goalposts to meet.
Yeah,
And I still, feel like it's pretty hard to say anything causes.
I honestly, I used to read it a long ago. I used to read about the consideration of causal possibility, which is by Bradford Hill.
Yes, that is what is
it's
in the module 6 notes. Yeah, Hill's criteria.
Oh, in module 6 as well.
Yes, so it's in.
So we talk about the evidence, the statistical proof, and the temporality, and so many things. But in the end, we're not for sure that something caused something.
Yes, but the problem is that even if we're not sure, we're still making decisions, right? Because right now there's a lot of food-based dietary guidelines, and many of them warn against ultra-processed foods, right? We are giving national guidelines that say, don't eat this, eat that, right? And that would suggest that you have some evidence, but like, what evidence is that decision based on? That's the question. So yes, we will start like academic, like researchers, we will sit and we will talk about causality and we will debate, does it meet the Hill's criteria? Like, is this enough? Do you need something else? Like, we could have an academic discussion, but at the same time, we are making policy about this topic, even with incomplete evidence. And most of the time, maybe like sometimes maybe that's okay, right? Like if you wait for every policy waits until everything is 100% sure, like you will never have like health policies, right? Like sometimes, so you have to kind of decide at what is the level of evidence you want before you make something into a policy. And that is not a simple question at all. But certainly for ultra processed foods in many countries, we are having metrics and discouragement of these kinds of foods. And the things you mentioned earlier are also recommendations. So the other paper, the one by Kevin Hall, was very focused on the American system, or just American population. This one too, I think, has a bit of, thing for American population. But this one, it's gone to sleep. But the Valicente paper also says there's some ethical issue here, right? Because if you have a food insecure population and a population with malnutrition, one of the things about food processing is you can add nutrients, you can fortify, right? So that is processing. Sometimes it's ultra processing, but that is potentially good, right? You can add things that prevent spoilage. So you improve food safety. And in places where you don't have clean water, you don't have, where infection is common, then improving food safety is important, right? So if you have preservatives, things will last for longer. They also won't spoil, so can also help with food security. So if you have a food insecure population, this might be a good way to improve access to food in a stable way over time. So does the discussion in the United States, like, we're all human, so there's going to be some biology, the biology is there, like it's shared, but the situations differ. The social situation, the economic situation, all of that is different. So how much does this argument apply to, say, Lao, or to, I don't know, East Africa, or like Latin America, does the same argument and the same decision apply to here? It's not a very easy question, right? And you are going to be the ones who are going to make the recommendations to the policymakers in the country about what foods should be promoted and what foods should be discouraged, right? So you have to make this decision, even if you don't have complete information, even if you don't like the burden of evidence, and there is no clear answer. Yeah. It is a big responsibility. I think they mentioned there was like one RCT. That RCT had like 20 people or something. If you check that one RCT with UPF, it was 20 people for like 2 weeks, which is not any time to see any kind of body mass change, right? So, yeah. Any other thoughts on this paper? I think in nutrition, there are a lot of unresolved issues like this. And when you look at, if you do kind of food and nutrition and like for a longer period of time, you will start seeing that the dialogues, are kind of in one direction. You wait 5-10 years, it's like moved to the other side. And then another 5-10 years, it'll come back. Like this change happens a lot. And this is one of the reasons that the general public gets very frustrated. Like there was a time where people said, don't eat fat. And then they started eating sugar. And then now we say, don't eat sugar. And then they start eating, I don't know, something else. Sometimes we say that butter is very bad, eat margarine. And then some years later, they said margarine is actually quite unhealthy. better eat, so people get very confused. If we were just doing animal studies or agricultural experiments, like you do the experiment once and you get an answer, you're finished. You have the answer, right? Here the whole reason we have meta-analysis is that even if we do 20 studies on the same question, we're still not sure, right? Like when I first learned meta-analysis, I didn't understand the point, because why would you do 20 studies on the same thing? I mean, aren't you finished yet? And you're still not sure, and then you want to combine them and then analyze more and then maybe do some more? Like, why aren't you finished? It's because there's so many other factors for humans, for people, and we're learning as we go. And so it makes this communication very hard. It makes it hard to make recommendations, and it makes kind of the general public and the policymakers actually very annoyed at us when we change our recommendations based on new knowledge. Kate's smiling. I don't know if you have thoughts on this whole issue.
I mean, always along with that is, in the ever-changing landscape of recommendations and this research is also where the money is. So, in the United States in particular, I don't know enough to comment on some other countries, but money, you have to cautiously look at research and see who funded the research, who the researcher is funded by, to see if there may be some bias in their research or their results. A lot of policy that's made in the United States is made because of big lobbying organizations and companies that push for what they want because it's an economic boon rather than the real evidence. So that's an issue as well. There are plenty of instances where, I can't remember, there was some campaign that Michelle Obama as First Lady wanted to do, and it had to do with schools. I can't remember, but it was about obesity and movement. And she was essentially prevented from doing this by the sugar sweetened beverage lobby in our United States government. So
That's bad.
That's bad, but it happens all the time.
Yeah.
In the US.
Even to Obama.
So the sugary companies
Oh, yeah.
Yes,
has
prevented the first lady from, because there were, I'll have to, maybe I can find the actual example, but there were essentially these other threats that they made. They said, well, if you do this, then we're gonna take, it was like the nutritious school meals or something away.
It was the school feeding
It
programs,
was
yeah.
school feeding
Yeah,
program.
they were the school lunch program.
Yes.
That's what we call it. Yeah, she was trying to change the guidelines of, of what is fed to children in schools. Yeah.
Yeah. And some of it is, agricultural, some of it is, yes, lobbies like sugar sweetened beverages, or you see the same thing with pharmaceutical companies with,
So they do a lot of talking to politicians, and, and they give money for campaigns, and, these things happen in every country.
yes,
even the first lady got prevented.
yes,
Oh my.
even the first lady. No one is immune because politicians come and go, but the lobbies are there forever. They have the power. So there are a lot of things that, don't get, good science-based research recommendations that don't get implemented because of politics.
And I think as a researcher, it also becomes quite difficult. So I think for me, like now, a little bit later in my career, I feel more stable. But I know when I'm, especially in the beginning of your career, you want to do work. Work requires money. And one place to get money is from companies, from corporations, right? And then that corporation, you know, if Nestle comes and says, can you do, you know, breastfeeding products or infant formula, right? I will fund a research on infant and young child feeding. But they're also selling infant formula, right? Are you going to take their money and do research? And then if you do research and you take it to a conference, one of the first questions is, who paid for this work? Okay, Nestle or Infamil or whatever, you know, somebody. Then will people believe your work? I mean, you might have done very good work, right? Like, and maybe you were very free to make any kind of conclusion, but because your funding came from a certain source, people might have doubt, right? And, you know, if you're a very senior researcher, like you have some freedom to make decisions. When you're early in your career and you just need funding and you need some budget, you know, it's tough to decide, you know, am I going to take this money, but I'm going to say no to money, like, but this is a really nice opportunity, or, you know, like it's not an easy decision. And a lot of people who are nutrition scientists are somewhere on the spectrum. They might do some things, they might not do maybe they work with corporations, maybe they don't, or maybe they work with some kind of intermediate entity like a foundation. Sometimes the corporation has a foundation that is nonprofit, but it's getting money from here, and then they fund research. That happens a lot. There was one time I was asked by a colleague to help with a project in Malawi. Malawi is in Southern Africa, and they were working on tobacco. And tobacco can be a health, but of course tobacco can be a health problem for users of tobacco, but also farming. Like you have a lot of child labor, and you feel, you know, like you can get the exposure from just touching tobacco plants. So they were trying to encourage, you know, other agricultural work outside tobacco. And it was a good problem. It was a good project, and it was funded by this foundation. And then, so then it was like, okay, yeah, I'm happy to write a proposal with you. And like, this is an important problem. And then I was like, what is this foundation exactly? And then it, you know, I followed. It turned out it is funded by Philip Morris, which is a multinational tobacco company. So the money goes to something, goes to a foundation, goes to an international research institute with a local, you know, institution, and then me. And like, you know, it's there, right? So I had a really hard time, like, do I want to take money from this to do smoking research, you know, and it's not an easy answer. It was not just like oh yeah, I'm never going to do it. No, because it's still an important problem. Yeah. And it was a lot of money that you can put to an important problem. And maybe you want to really solve this problem. So you have to kind of decide. And these kinds of things will stay with you, you know, as you are a researcher, what reputation you have, it will never go away. Right. So if you are, you know, if you're working with a corporation, like people will remember 10 years later that you did that project with Philip Morris, or Nestle or whoever, you know, like they will know that. So you have to think, you know, and people are on the spectrum. It's okay. I'm not saying never work with corporation. People do, and they do good work. But you have to think what it implies for you in your career, because it is a choice.
And there might be something that we feel to reject. I mean, the company.
But it is hard. It is hard when you feel a pressure, for example, to have new projects, to get grants. Your institution is expecting you to have more projects, right? That's a metric of success. So yeah,
Something, you know, potentially, you know, innovative, or something that maybe national institutes and all that was funded yet. I worked on lung cancer work in Kentucky, and one of my projects was funded by the state lung cancer program. But that program was funded when tobacco companies were sued and told they had to put a bunch of money into pots in each state that the state could then use for anti-tobacco work in advertising. So in that case, I am gonna take the money because it's regulated not by the tobacco companies. It's regulated by the state.
The government.
Yes, and it's a competitive, they're trying to work against the effects of tobacco, but the tobacco companies were forced to pay it because basically the lawsuit said, you're causing harm. You're not gonna stop making cigarettes, but we want you to put a bunch of money into these funds across the United States that will help fund work against tobacco.
So to get somebody standing in the middle for that money. Yeah.
To get some-
But, well, somebody, it depends
I
on
mean,
who the
it's safe.
somebody is. If this somebody is the government, which is public, that is the people kind of, like, that might be better than an intermediate foundation, that is
Yeah.
kind of like,
Yeah, and these have, this had a board, of people who, it was all public health people who sat and decided where you competitively apply for this.
Does the tobacco company increase the price of the product then?
Oh, did they? Oh,
Oh.
that's a great question, I'm sure that they did. You know what they did, they ended up making vape, that kind of.
the
which is
vaping,
now
yeah.
Vaping, that has been picked up by young people. So, I mean, tobacco companies live forever. Also.
They also went to LMICs when the high income countries started doing more regulation
Yeah,
about advertising and so on. They just went to low and middle income countries and started doing work there. And trying to get more people smoking there, like here. They went elsewhere to get, but there's billions of customers available, right? So,
yeah, there's always need.
Here we have a lot of, we have a lot of pictures, scary photos and on the tobacco package. I'm not so sure how interested, but I'm not sure if the people care about those pictures.
Yeah.
There's a lot of research on packaging.
Yes.
How is that?
It's a huge field.
Yeah. I can show you
Same in every country.
Right, I can pull some of my lab I used to work for, evaluated some of the packaging, potential packaging before, when they were considering putting those scary images and messages on packages in the United States.
My favorite one is that in one of the countries where they decided to require the scary pictures. And also big black, like in Thailand, a big black box that says, this can make you have lung cancer, this can make you die. And there was no impact until one of the messages said, this can make you not able to have sex if you're a man.
Yes,
Because you can be impotent.
yep,
Then there was impact. So lung cancer, die early, no one cares.
No problem.
so, it's talking about is like, you have to base messaging on values.
Yes.
And people don't value not getting lung cancer, something that happens way in the future. But they sure as heck value being able to have sex that night or tomorrow. And so really having to target messaging towards people's values. There are ways of collecting that information, which is something we'll talk about if we do more.
FBCT.
Mhm.
But clearly, we do have evidence, right? So
No, they cannot, the government cannot require the tobacco company to put a wording that is not true. Right, they can't say like, it will make your hair turn purple. They can't say anything, I mean, it has to be based on evidence. But the issue is finding the evidence that market, the consumer cares about this stuff. So this is a big issue in breastfeeding and IYCM, is that oftentimes the messaging is, this is good for your baby will grow up taller, your baby will have bigger IQ, this kind of thing. But the formula messaging is, this is easy, this will save you time today and make you less stress.
Yeah.
And whether or not the market is responding to long-term messaging, short-term, right? It's not about the message being true or false, it's about whether or not it connects with the person that's being marketed to.
And changes.
Yes, it's true that smoking can cause symptoms.
interesting. I don't smoke.
Many medical people smoke, actually.
In Lao, when I do behavior change, we don't use the example of smoking because smoking is not very common here, but we use the example of regular significant consumption of alcohol.
Yes.
That is a widespread behavior.
Okay. Anyway, these are a few questions, like just thinking about the debate when you hear these kinds of controversies. And the other thing, like, I think sometimes when I work with colleagues, and it's certainly in other countries, like sometimes when you see something in a journal, you think this is truth, right? You read a paper and you're like, this is true because it's published, peer-reviewed, international journal. But like, you can still ask questions, you can still challenge. And you can see even in these papers, like they are arguing about a topic that has a very strong health implication, public health implication. So even when you're reading papers like this, you can say, there were papers in that very long paper by Valicente, like there were some statements there I didn't agree. I'm sure, like, you know, if you ask me, like, which ones didn't you agree? And you ask Kate, which ones she didn't agree, like we will have different ones, right? Like we don't agree with everything. And we can make an argument for them. And the same thing for you, even if it's published, you can be asking questions and you're not required to believe the argument. And when you are writing papers, you want to make your argument very strong so that people are convinced. But there will always be people who will not be convinced by your argument as well. So, but you can keep asking. Okay, so keep asking questions. It's useful. Okay. Okay, where are we? Okay, shall we talk? It's 2 o'clock. I did say today I would talk a little bit at 3 o'clock about anybody who is interested about applying for US study. So I have some notes and we can just talk about that in an hour, but we have an hour until then. So what I would like to do is continue what we did last time. Just we were almost finished with this, but we had a lot of new ideas last time. What did you think about the material from yesterday? What's that? Any questions? We covered a lot of information in one day. So let me just kind of refresh and go back because we didn't 100% finish this. And I would like to. So here we are. So we talked about this study a lot and the different meanings of the types of analysis. And then we started looking at mix. We started looking at like just kind of very practical things about looking at data, how you check variables, how you make sure that the data are clean. Even if you get something like mix, clearly the data are not 100% clean. You still have to get familiar with data, make sure you're okay with it, make sure you understand what's going on. And then we did some examples of t-tests. We were looking at height for age, C-score, which is a continuous outcome. We looked at t-tests and just what it was and what kind of null hypothesis. So we asked one research question, like, are there sex differences in height for age among children under 5 in this country? And we concluded that there was not a whole lot of evidence for that. And this was the result. Were you okay with this? Is this refreshing? You remember? Yeah. So one thing we did when we played around with this was look at this idea of making kind of special variables that are indicating yes or no of a certain condition you're interested in. And I called those indicator variables. So we made a variable that says yes if it's a man and no if it's a boy, and no if it's a girl. And we used that in a regression. So we did a t-test, we came with a certain result. So you can see here, height for age, there were some very big values of height for age that we thought were mistakes. So we exclude them. We only take ones that were of a reasonable value of height for age. We did a t-test by the sex of the child. And so we had male and female. This was the difference between male and female. And this was the p-value. So we reject, we do not reject the hypothesis of these two, of girls and boys having similar height for age, right? There's no evidence to say there's a gender difference in height for age because we had a certain p-value. And then we did this thing where we did a regression of height for age using this indicator variable, where we have 1 is equal to yes, it's a male, and 2 is 0 if it's no. And we ended up finding the same numbers, right? Yes, no, maybe.
Yeah.
Oh, that's a-
Yeah.
yeah.
Yes, it is not the same.
So this is a sort of trick, right? So just, yeah, so we did this at the very end, so like making sure it's clear. So what we did was we had this variable, I called it male. And this variable that's called male is equal to 1 if, yes, it's male. Yes, child is male. Is male. And then equal to 0 if not, meaning it's female. Right? And then we do a regression. Regression looks like this, right? Beta 0 plus beta 1 x. And this variable is our x. And this one is height for age. And Roger had finished telling us like, no, you can't do regression to the categorical variable.
Yeah,
But we did it anyway.
yeah,
And
you cannot step outside the box.
this is all about the box, getting out. So the interpretation of the slope, which is what? This negative 0.08 is how, the meaning of that number is what happens if this x goes up by 1 unit. And if the x goes up by 1 unit, you go from female to male. So this number that we estimated, which was negative 0.08 something, means that if you go from female to male, if you compare the male to the female, this is the difference. And that's usually what we're interested in, right? We're not trying to say that the mean height for age for male is negative 1.5 or something, because what usually we don't use that number. What our research question was there a sex difference in height for age? We really, the whole interest is to compare the male to the female and see if there's that difference. And what we're finding is that the difference between male and female is very small. They're very close. And so close, and that number is so close to 0 that it's not significant. The p-value is pretty big. So this idea of doing something categorical like this, where you put a number, you could have done 1 and 2, and that would be the same comparison. Just it's always this number is always, if this x goes up by 1 unit, how much does y change? That's the mean. So this is fine because we could have done a t-test. We didn't have to go through all this. But there's a point at which it becomes helpful, which is here, right? We were talking about, well, what about wealth, right? And we looked at this wealth category. So let me find our data again. Let's see, fix. Where's our data? Here it is. Kate, I don't know if you know how to make the font size of Stata any bigger, because mine is just like wicked small. So I've been putting it into Word to make it bigger.
Oh.
But
I can do that.
Okay, so I think, I didn't save it, so tab. So we had looked at this last time, and this was wealth quintile, right?
High level, it's 20.5.
20 means 5, yeah. Is that?
Maybe 17, maybe 17.
No, okay. Single. So here's wealth quintile. So we noticed something weird here. So the values, there's underlying values for these labels. So poorest to richest is kind of category 1, 2, 3, 4, 5. And they have a label that's poorest, second, middle, richest. And then there was this weird one with 0, looked like it was missing data. So we said, okay, like that's a mistake. You can fix it so it becomes missing data, or we're just for now, for the sake of for our practice, we're just going to omit those. It's 13 children that for some reason have an invalid wealth thing. So we're just going to leave those guys out. Okay. So we looked at that variable and we said, well, okay, what do we do now? Here's the question, right? Actually, what is this? We're still looking at height for age. And now we're looking at wealth. So what is my kind of underlying research question here? Like, what am I trying to ask?
Oh, it was yesterday.
Yeah, I'm just refreshing from yesterday because we are going to go take this to another.
It's right now it's like someone said, not me.
Did anyone have notes from yesterday? What's our research question?
It's okay.
We assume that the same, not different about, high. SI, test is not different all the.
Research question.
Also question.
Do the
Shine.
do the average. Do the average height for age C-score
Cisco.
in children vary in different.
There are many ways to write this, right? But do you have
Anyway,
S A
depending on household wealth.
Yeah. And there are different ways to say it, you know, and
It's
it's
different from
English.
yesterday's question.
Yeah, but it's the same idea. I mean, you say in Lao, you say it always the same way, right? Like, that is the question, and your hypothesis when we talked about it yesterday was like probably that you see a higher height for age in wealthier households, right? Here, I'm going to say household. With higher height for age on average. And if you want to be like very, very proper, you would say wealthier households in Lao PDR will have children under 5 with higher height rate. You know, you want to specify your population. You're not talking about Thailand, you're talking about Lao. Like you're not talking about school age children, you're talking about under 5. So if you want to write it very well, like, you know, for example, for a publication, you would take some time to write the sentence carefully. But that's the idea. So we have this null hypothesis, which said that no, everybody, every kind of wealthy households of all different kinds of wealth would have similar or the same height for age on average, right? And so we talked about the mean for
the mean, so this is like mean height for age. And the mean for the poorest families would be the same as the mean for the, what do they call it? Second?
Wait, there was names for this, let's look. For second, middle.
Again, both averages.
I'm not gonna write again, but you get the idea. All the means are the same. Everybody, the height for age is the same
Regardless of the wealth of the family. And when we did this test, and I think we ran the ANOVA already, right? I think we looked at that at the very end. Yeah, I think we just started to look at this. We did an ANOVA. This is just like a t-test, except now we have 5 groups instead of 2. And that would be ANOVA, or analysis of variance. And we found the p-value is really, really small. That SAS will, or sorry, Stata will like round it to 0, but it's more like saying it's smaller than 0.0001. So it's rounding down. So that means we reject this, and we say at least one group has a different height for age. Yeah. But then the question is like, okay, which one? You know, are they all different? Is one of them different? And we can kind of see here, right? This was the means. Let me just making it bigger for myself as well. This was the mean for every category. So in the poorest households, we found that the mean height for age was negative 1.87. Oh, it's not working? Sorry. I think you told me. Is it okay or not okay? Should we take it out and put it back again? Ah, great. Oh, yeah, I got it too. Okay, yeah, so the poorest ones was negative 1.8, which was very close to that kind of cutoff or something, right? But we're talking about the average child. And then it was a little bit higher in the next wealthiest group. The middle group was a little bit higher. The next one was even higher, and the richest was still low, below average, but higher. So there's a very actually nice trend that is happening where height for age on average is increasing with wealth. And yeah.
What was the Alex test for equivariance?
Yeah, that is a great question. That is looking at the variance within each groups. Right now, I'm just ignoring that. But notice how the standard deviation is actually smaller, 1.3 compared to 1.7.
Because I'm just curious, what if it's not equal to variance?
Usually these methods are kind of robust to this sort of thing. So what I would do is, you remember when Roger was doing residual plots, I would graph it. So if we were like really getting into this, you should be doing some residual plots and just see if the variance is like a little bit or a lot. Yeah. Most of these methods, there are, if you remember from Roger's discussion, there are some assumptions. One of them is that this variance or the standard deviation would be similar across the different groups. You can be a little bit different from it, but you can't be a lot different from it. And if you are a lot different from it, then you have to kind of change your model somehow. Maybe you would take a, log transform of height for age, or you would do something to make sure that the assumptions are satisfied. So that's a whole area, but I'm not gonna get into it.
But in this case, equivariance is good, right?
I haven't done a residual plot, to be honest, but if this were my data.
I mean, if you see equivariance, that means good.
Equal variance would be good, but here you're rejecting, it's a p-value small, so it is a little problematic. And so if I were doing a paper, like if this, so I'm doing an example for you guys. If I were doing this for my research and I wanted to present this at a conference, I would be definitely checking that residual plot and making sure it's okay and I'm satisfied with it. Like for every single model that I run, I do it. I just I write the code to automatically do it for every single one, because you want to make sure the assumptions are satisfied. But I'm not gonna get into assumption checking right now, because what I want to do is think about how I want to compare these. And there's multiple ways to compare this. And I think when Roger did the ANOVA example, he had something where he was doing pairwise comparisons. But I don't necessarily want to compare every group to every other group, right? I don't want to look at second and compare it to fourth. And I don't want to look at second compared to richest or poorest compared to middle. Like, you don't want to look at every comparison. You just want to, probably what you want to do is take one of these categories and say, are the others different from that? Right? You want to kind of understand what's going on. So what is often common in these kinds of regressions is this. So I'm using here regress. I have height for age, that's my outcome. I have this wealth index 5 categories, and I'm doing it as a regression, and I put this I dot. And the I dot, the meaning of this I dot that is in front of this categorical variable is to tell Stata this is truly a categorical variable. You know, the number is 1 to 5, but that number is not meaning anything. It's just the label. I could have done 2, 4, 6, 8, 10. You know, like, it's just an arbitrary label because I needed to enter my data, and 1 to 5 is the easy way to enter my data. So that I dot is saying this is a categorical variable. And it's basically doing then the same analysis, but what it's doing is it's making that indicator. Remember how I said 1 is equal to male if it's true, if 1 is yes, it's a male, and 0 is no, it's not a male. It's making now not just one indicator, but 4. So it's making an indicator for being in the second category, for the middle category, the fourth one, and the richest. So if you're in the second category, this variable second means you're in 1, the value is 1. And if you're not in the second category, for that variable, the value will be 0. So it's just telling you, like, okay, here's a variable that says the people who are in the second, middle, and fourth. Now, if you are in none of these, if the value for each of these variables is 0, then you must be in which category?
0. Be poorest.
You will be in the poorest, right? Like, you either have to be in one of these 4, and if you are in none of them, then you're in the poorest. So, yeah.
The reference group.
Exactly. So what this is doing is it's taking the poorest category, the first category of the wealth index, and saying that is the reference group. And everybody else I want to compare to the poorest. So I have a height for age that is in the poorest group. And then what is the difference if I go from poorest to second? The height for age will change by 1.17. The actual height for age C-score of the second compared to the poorest, that difference is going to be 1.17. This number right here. What's that? That is the actual number. So look at this. The poorest one, the average was negative 1.87. The second one was negative 1.7. What's the difference between these two? Point 0.17. Yeah.
Is the number of is meter for the model yeah, we can see.
So, I'm not getting you, Ken.
So the number of each book is not the same.
Oh, the sample size?
Sample size, yes. And it is because the forest is 300.
I think that is just by chance, because this is just a subset of the mixed data. And some groups have more people, but they are independent of each other. So it's like a t-test independent sample, except instead of 2 categories, you have 5. But if you look at the difference, 1.87 and 1.70, what's the difference between those two?
0.1.
What is it? 0.17. Exactly.
Says it again.
It's that number. The difference between poorest and second, that difference of 0.17 is that coefficient. And that's what you want to know. Likewise, if you look at poorest,
สไลด์ของพี่มันจะมีตัวห้องมีตัวpolicy statement แล้วก็อะไรนั่นแหละของพี่เนี่ยคือเขาตัวนี้เป็นคอมเพลต์มันเป็นความแตกต่างกันไหนก็ดูสไลด์ตรง
She's not asking, but she was trying to explain to her colleagues.
yeah.
And she's right.
She's right.
Women always right and men always left.
Yeah. Like
Right there.
I didn't say it, you said it.
Get a joke here.
Okay, so let's do let me see. Okay, so for example, if I compare richest to poorest, right? If I wanted to know what the difference is, right? So you have mean of richest minus mean of poorest. Right? Well, in your sample, this sample here, this mean of richest is what? -8. Like that. Mean of poorest. Is it 8.7? Yeah. So minus becomes plus, right? That is 1.07. It's almost it's more than 1 unit increase in height for age. It's actually a pretty big difference. The difference between the average richest and the average poorest is a pretty big difference. So I'm looking for this number 1.07. It's right here as a coefficient. So as I go from poorest to richest, then the height for age should increase by the slope, 1.07. So all of these estimates, what they're doing is they're looking at this difference. So difference compared to a category, which is the poorest children. So you pick one that is a comparison group and you look at the difference. So these are answering a few different questions. So when I do ANOVA and I find that this is very, very, very significant, all I'm concluding is that the height for age is really differing according to the wealth of the family. And then the question is how? Well, what we find here, and there's a p-value right here. So when I'm comparing this number that is only 1.17, so that's second versus poorest. So poor and a little bit less poor. That difference is not that significant. It's a little bit better HAC, but it's not significantly different. If I take the poorest families and I compare it to the middle, now the difference is 0.46, which is like half a standard deviation. That's a lot. 0.46 is a lot for height for age. And actually that number is, the p-value is small, so that number is significant. If I look at even more wealthy families, then you go to 0.53, that is highly significant. And then if you go from what we did here, the very richest to the very poorest, then it's more than 1. And that is highly significant. And so you're seeing this like rather nice dose response, right? The more money you have, the more wealth the family has, the better the height for age is. It's still negative on average, right? Like, I mean, we're not completely satisfied, because we can see that on average, we expect, if the population is healthy and it's growing well, that mean should be 0, and it's negative 0.8. So we're not like 100% satisfied, but we are seeing improvement due to wealth, right? Does that make sense? This strategy of kind of comparing to a reference group is very common, and I'll share some papers where you see this kind of result. This is often how it's presented. Now, there is one small concern that you might have with this, and that is that issue of false positive. So remember, we talked about false positive, and we always said there's always this chance alpha, you might have a false positive, and we don't want to make mistakes, right? So if you do one statistical test, you have a certain chance of false positive. And then you do another one, and that one also can be a false positive. And then you do another one. So the more you do, it's becoming more and more likely at least one of those things is a mistake, right? Your chance of any kind of false positive is increasing the more statistical tests you do. And for us, we collect so much data, we do so many statistical tests, like we probably, like I'm looking at UCAPMany, who's like has maybe 500 statistical tests in one study. Some of those will be false positives, for sure. So one of the things we do in this kind of scenario, so notice here, this is just one test, but here I just did 4. So 4, okay, it's fine, it's okay, but like I'm gonna do more variables. And after a while, I really have a lot of statistical tests, so one of them is gonna be a mistake. It's probably sure one of them is gonna be a mistake. And you don't know which one, right? And you don't wanna make mistakes. So what I typically do is I kind of do this ANOVA first. And I just say, are all the groups the same, or is somebody different? I do this test first. Here, I know they're different, and then I can ask which one is different. Then I can go and do this. And I can really tell you, like, okay, as they're getting wealthier, then it's becoming more and more significant. I can tell you a story, right? If I do this first, and the p-value is not significant, I stop. I don't try to say, okay, the groups, they're not different. But who's different, really? You know, like you're looking, searching, that will increase your chance of making a mistake, right? And this is extremely hard to do. And I've always find that bosses don't like it, because everybody wants something to be significant, right? Like you want to find that significant result, and you can tell people, and especially like I have had bosses who are like, yeah, but can you check this? Can you check that? Like, surely something is going to happen, you know, and you just tell them no. Like, suppose this is not significant, then all of those 5 groups are kind of the same. Stop. Don't look more, because if you look more, maybe you'll just get lucky and you'll find something and it's a mistake, right? So sometimes they call this like a protected test. You protect yourself from making an error by doing this first, and then if you see something significant, you start investigating further. It is very hard to control yourself because it's very easy to just, you know, let me just check and see, but try to resist that kind of thing. Does this make sense? We're going to make this more, we'll get into it more as we start looking at multivariable models, a lot of studies will have that structure where you have reference category. Yeah.
Yes, no, may I ask you more like if we did some one test but not significant, but we interest in that, should we do? Continue now?
Honestly, no. Like if you like, because this test that you do that is similar to ANOVA, this is trying to ask like an overall global test. And the 4 tests of every all 4 categories can compare to the poorest category, the reference category. That's sort of like the next level question, right? You shouldn't ask this question if you know that they're all the same. You don't go and say like, well, then who is different? Because you just said everybody's the same.
Right? Yes. For example, we have like a social demographic, like a age, shape, or some education, maybe. And we test like this is not significant, but we interest in like how can maybe when I did some research, small research, I do like chi-square first, is relationship with outcome or not. Some significant but some not. But when we would like to do like a
multivariable model.
Yeah. Or some we would like to see like the odd. It's even though they didn't the variable is not significant by chi-square, but we would like to see like the odds.
Right, yeah, we can talk about that because it's so the thing is like you kind of just look 1 X, 1 Y, and you look at many of them, and then you're asking like, well, I can put everything in the model together. There is no perfect rule. So some people will look at the p-value and decide whether it goes in the multivariable model. Other people will take all of them, regardless of p-value, and put it in the multivariable model. Some people do this kind of stepwise selection, it's called, where they put some things in the model and others in the model. Like there's a lot of different methods, and there's no correct method. And people will argue and debate. There's some standard kind of commonly used ways, but they're good or bad, or so many people I know will kind of look at the kind of 1X, 1Y, look at the p-value, but have a very high p-value, and say like, okay, if the p-value is less than 0.2, I will put them in a multivariable model. But that is an arbitrary cutoff. You can pick 0.3 or 0.05, you can pick anything. There are other people who will say that everything I'm looking at, every statistical test has a hypothesis behind. I didn't just pick every variable just to try. I had a reason. I truly believe wealth is related to child nutritional status or height range. So that is why I'm testing this. I didn't just pick it for fun. Like I have a hypothesis about this. And therefore it should be in the multivariable model. So some people will just put everything. And you can debate, and then other people will say like, well, it's too many in a model, and there's some disadvantages of putting lots of variables in the model. And so then they will say like, those disadvantages are too much, like let me reduce using a p-value or using some other criteria. But there isn't a right answer. So you have to come up with a method, and it's perfectly okay to say like, in the literature, I see people using it this way. So I copy them and do it the same way in my data. Okay, that is fine to say this is the conventional approach. I use what other people are using, and okay, that is fine. I tend to argue more, so sometimes I say like, I really want to see this in a multivariable model because I really have a hypothesis. And even though in the kind of bivariate sense, it's not significant, I want to see how it interacts with other variables. There's no like right or wrong. I think what you do want to do, and I'm not doing it here, but so I'm being a bad example to you. But what you do want to do is do things like model diagnostics, like those residual plots and so on. Because what you do want is however you make a model, there's no fixed rules for making a multivariable model. So however you make it, you want to make sure that you can justify and you feel very comfortable the model is good, which means it satisfies certain assumptions, like those residuals should be normally distributed, the variance should be approximately constant and so on. So you want to just check and be comfortable by yourself that you have a good model. Yeah? And because there is no right way to do it, people will argue with you. So you have to be ready for that too. Like when you get if you submit something to a journal, some reviewer will come back and say why, and why not this other way? Like it happens. So you have to just be ready. You can say like, you can tell a reviewer, no, I disagree, but here's my reason. And then you have a good reason. You don't have to do everything a reviewer says, but you have to have good reasons to say no. Yeah? Okay, so we're going to build on this, but let me, in the time that I have, let's talk about logistic regression. And I will start this and I will try to finish it tomorrow with a lot of examples depending on our time. So are you ready? We can do it for 22 minutes and then we go to the optional. I'm going to take your phone away. So in order to do logistic, it's okay. Is there discussion or?
Yeah, we discussed about the coding. Yeah, I discussed about the course that we changed from YC. Actually, that the number right, the original one is the number 1 and 2. When you want to use the regression.
Oh, the coding. Yeah, okay. Yeah, okay. I get you. I was like, what coding? Yeah, yes.
It's a little bit that we discussed about that actually that the 1 and 2 is a number, right? But when you want to use the regression, maybe you change from 1 to 1 0.
Yeah. Yeah, I think and a lot of these like mix will use they don't use the 0-1 coding. I think for me the 0-1 coding makes a lot of sense because 1 is the thing you're interested in, and if it's missing the thing you're interested, then it's 0. And you saw that trick I used of just taking the mean of that gives you the percentage. So there's some nice properties of using the 0-1 coding, but it's not necessary. Because the interpretation is just going from 0 to 1 is the same as going from 1 to 2, right? So as long as you're coding them in that kind of way, that where there's 1 unit difference, then it's okay. So if you code it like 10 and 11, it's also okay, right? Because you're just saying that if it changes by 1, what's going to be the change in Y if you change X by 1 unit?
But the smaller number will be risk, right?
Will be what?
Risk.
Risk?
It will be outcome.
Well, yes, it will be the outcome, which right now is quantitative. Okay, not yet. Now we're going to get into binary outcomes. But before, height per age is a number, right? So by going from from male to female or female to male, from going from poorest to second, the second wealth, you're going from one jump to the other, one category to the other category. What is the average change in the Y? And the Y was a number, mean HAZ. Now we're going to do something where we make this, instead of the Y being continuous, we'll make it binary. And that's going to be different.
The one that for the wealth cut and classification, right? We have to find levels of the wealth classification, right? This one, and from the corrects and to the recess. When you run by using the regression, it still come up with you for the difference of the mean on the coefficient.
Right.
It doesn't matter that we use the regression category for.
No, what it is automatically doing, and the key here is that when you do the regression, the syntax is slightly different. You add this I dot.
Okay, yeah.
If you omit that, you will have a problem, because then you're gonna do this weird thing, which is like you graph. I know the blue is not as easy. Yes, if that I dot is missing.
Okay,
So
so
like,
now it's main thing for me.
yeah,
That I not noticed about you put time.
yes, exactly, yeah. So then it's like this weird regression, and you know, it might be okay, but like, you know, like. Okay, I don't know in Lao, like what these categories are, but you know, like if this one is like in dollars in the US, this is 0 to $10,000, and this one is 10 to 20, but this one is 20 to 50. You know, these categories are not necessarily all the same, right? Like going from here to here might not be the same as going from here to here. These people might be very, very low, right? So this might be a small difference, that might be a big one, and just drawing a line. Stata doesn't know, it's just going to draw a line. So that's a problem. So the whole key is this I dot. And that is telling you it's categorical, and what you can do, if you have this mixed data, or if you have any data set, just do both. Just try regression has with when in W index 5 with the I dot and without the I dot, and see how it's different. The way it will be different is with the I dot, it makes 4 slopes. But if you take it out, it'll just be 1 slope. It'll just be whatever the slope is. And it'll be weird. You won't know what it means. Yeah, nice observations. Okay, so in order to talk about logistic regression, I'm going to have to talk about logs. So this first slide is a mathematics review, and hopefully it is review, but it might have been from a very long time ago. So just want to refresh. Okay, so logistic regression uses log. And when I say log, I'm actually going to talk about natural log, or LN, which you might have learned back in school days or something like that. So I'm looking at the natural log. And so this is what it looks like. If I graph this y equals natural log of x, the graph looks like this. So it's not linear, but it's always increasing. But it has certain properties, right? So for example, this x value, there's no graph on this side, right? This x cannot be negative. Actually, even the x cannot be 0. It has to be greater than 0. So log is something you can do for a positive number only. That's first rule. Once you take the log, if you look at the y-axis, this one will go down forever. And this one goes up slowly, but it will go up forever. So the value on the y-axis, the logarithm of any positive number, can be basically negative infinity to positive infinity. So that's another nice property. And this is one of the big reasons we do this. The log of 1 is 0. Right? So if x is 1, then y is going to be 0. If the value of x is here between 0 and 1, then the log will be negative. And if x is greater than 1, this log will be positive. Okay, and then there are certain rules. If we take the log of 2 numbers, then that value is going to be the log, the sum of the 2 logs. So if this is a product multiplication, then this will be a sum. And if this is a division, 2 numbers, then this will be a difference.
That was in high school.
Yeah, so probably not the most fresh idea in your mind, but that's why I tried to put all these rules into one slide so that you can slowly remember these things. Now, if you want to solve for x, if you want to solve for x, then you take something to the power e, right? E is this number, yeah, exponential. E is a number that's like 2.7 something something. It's a number that occurs in nature. It's actually got some, it's a very lovely mathematical thing, but basically it's just some number and you take it to that power, right? So so I'm just going to use some notation here. I'm going to say sometimes when you just write on PowerPoint and you try to put it as a superscript, it's hard to read. So sometimes if I just mean e to the power y, I'm just going to say exp to say that it's to the power y. So that's just a notation. So if I want to write this, that's a simple way to write it.
So
Yeah.
just to try to memorize, I'm not so sure about the LN, the natural log.
Yeah.
Is it the same as the log of the root 10?
No, it's log of the root e.
That's root E.
E.
80.
E, that number 2.7.
2%.
So usually if you learn this in school, you probably learned log 10, and then you learn this log e, and that is the ln. And that is what we're doing. But sometimes when we talk, we just get lazy, we say log, but what we mean is this ln. So it's always to this e power. You can find it on the calculator, especially actually if you use Excel, I think the function is exp. So that's why I'm writing that just for clarity. But basically if you have y equals ln of x, and you want to solve for x, then x is going to be e to the y power. Yeah. So sometimes we will want to have y, but we have x and we want y, and sometimes we want to go backwards.
Okay.
So we have to take something. So to solve this, we would go, if we go e to the y is equal to e to the log of x, and then going to the e power and taking the log kind of cancels out. So you get
Y.
So I know it's been a while, but unfortunately, this is what we use. And the reason we do this will become clear. So let's do this. So the whole point of this is we want to now look at binary outcomes, right? Those outcomes that have only two possibilities. You have anemia, you don't have anemia. You have stunting, you don't have stunting. You have a disease, you don't have a disease. So many health outcomes, or many health and nutrition outcomes are going to be this way, right? We're not interested maybe in all of hemoglobin. We just want to know, is this person anemic, right? That's the outcome we want to know. So this type of outcome is very common. So I'm going to call now this y, like we always had our y. Now we're going to use the 0-1 idea. And the 1 means that the thing we want is occurring, this event of interest. So maybe it's anemia. 1 means the woman has anemia. 0 means no, they don't have. And remember, I call this event of interest, but event of interest can be something good or it can be bad, right? It's just for us, it's interesting, but it can be death, right? Like 1, the person dies, and 0, they're still surviving. Right, so event of interest doesn't mean good or bad. It just means the thing we want to study. And unfortunately, we study bad things. So it might be negative. So because these things are two possibilities, then there's a probability, right? There's a probability of being anemic, and then there's a probability of not being anemic. So the probability, let's call it P, like little p, is going to be the probability that this event is happening. Okay, so that P, we want to know what it is, right? Like, what is the chance of being anemic? And maybe we have an intervention and we can change that probability. That's our hope, right? We want to reduce the probability.
Can I ask back?
Yeah.
Well, why E is equal 2/7. It's
There are beautiful mathematical reasons that we can talk
because
about.
everything power to 0 equal 1.
Yeah,
Why
yes.
why it should be
E is no different, e to the 0 is equal to 1,
everything, yeah, everything
which we know
Oh,
because the ln e,
no x, I think.
what?
X isn't it? So no.
Yeah. Everything to the 0 power is equal to 1, including e, so that is true. Cause e is just a number, it's, so 2.7.
And where is it from?
And I don't remember exactly what it was. It goes on until infinity and it has some like geometric. It happens in nature and in
By nature.
geometry,
and so that's why we have it. It happens in a lot of really interesting, cool places in nature. But
That is it.
I mean, we can, yeah, but we're not doing mathematics, we're doing, you're doing nutrition, so let's stay on this side of the topic.
Just
Um,
use it.
Yeah, just use it. So, okay, so P, we have this probability of the event of interest. So what is the probability of the opposite thing? So if P is when you have this Y, your outcome is equal to 1, the probability the event occurs. Then what about the probability the event does not occur? What's that number? Yeah, so maybe our event is probability of anemia. And that is 0.25. So what is so what about the probability of no anemia?
1 minus 35.
Yes, exactly. So the opposite is always, if this is P, it's 1 minus P. Okay? And remember, we built odds this way, right? Well, let's remember odds. Let me go back. Do you remember the example from yesterday? Do you remember this? Yeah, we talked about odds. This is the probability something happens, this is the probability it doesn't happen, and the ratio is just the odds. And well, that's what we're getting to, because remember, we want odds ratios, we're going to build up to that thing. So we wanted probability, we can think of the probability when something doesn't happen, just 1 minus P. We take the ratio, it's the odds. And then we even went as far as the odds ratio, which is 2 different scenarios, the odds of this scenario and the odds of this scenario, take the ratio. And then we kind of thought about what it means and talked about that. So now we want to do this in a model. So let's try and see how it goes. Not that one. Okay. Okay, so this is what the logistic regression model is. You've got the probability of something you're interested in, like anemia, divided by 1 minus P. You take the log, and again, here log, I mean natural log, that log base E.
The loss of.
Yeah. So, and then it's equal to the exact same thing as before. We have an intercept, we have a slope, we have our X, which could be, anything. Anemia, this could be income of the family, could be maternal education, whatever it might be. So you're right. So the part in this parentheses, that is the odds. So this is the log of the odds. It's just our regular line. That is what you're doing when you do logistic regression. So why? Why do we go so far? It seems a bit, it seems like there are simpler ways to do this. So why don't we just do P? The probability is equal to this.
No, we want to see the difference of power,
Power.
because that is the log P by 1 minus P means the Y,
Yes.
the outcome.
Uh-huh. Well, the outcome here, the outcome is a 0, 1. The outcome is I have anemia, I don't have anemia. That's the outcome. And it's categorical, it's not even a number. So the number is the probability
Yes.
that I get anemia.
It can be 0 or 1.
It can be between 0 and 1. Right? But that's a problem. If I say this is too complicated, let me just put probability here. That's a problem, because suppose this is maternal education, right? And okay, fine, if somebody has like 1 or 2 years of education, if they have 12 years of education and you try to predict what is the probability, you might find a probability of 2, right? You just do a linear regression, but probability has to stay between 0 and 1. So you can't put it in a model like this, because sometimes your model is going to give you some impossible probability. Like imagine if it's negative, right? And you get a negative probability, it doesn't make sense. So we have to do something where this number can be like legitimate. So probability can't live here, but this is odds. Odds is a number more than 0, right? Which means that it's perfect for taking the log. If you have a number that is more than 0 and you take a log, it'll go from negative infinity to positive infinity. It will work like any continuous number. So that's what we're doing. That's why we bother to do this, because we need to make this linear regression, we need to allow it to work. And if this is constrained somehow between 0 and 1, we won't be able to do that. Because at some point you're going to have some kind of X that makes it impossible value. But log of an odds can be any number. It can be negative, it can be 0, it can be positive. So we can do regression. And that's what we're going to do. Yeah. So I'm going to, I think that it's a good place to stop. You have the slides, we will continue, and then we will do examples, because it's always just nicer to see lots of examples. So here's the model again. Can you see if I do that? No. That's annoying. Yeah. Okay, here's the model again. That's good, right? Now, if I try to take e to the power of both sides, so I take e to this side, then I just get the odds is e to this thing, but the exponential of a sum is the product. So here I'm just, I'm refreshing my algebra and it's a bit stale, but this is just doing the algebra. So there's a few tricky things here. So remember, we want to always do this thing where X is going up by 1 unit, then how much does Y go up? But now Y is log of odds. So now we have to work on interpreting, and interpreting this is a little bit hard. And as Kate was saying, like, as scientists, as researchers, we want to like be very precise and correct, because people are checking us and we want to, be rigorous. At the same time, we want people to understand us. And with logistic regression, that is going to be hard, because this is a little bit, it's not as intuitive, right? But it's necessary because of the type of data that we have. And you're going to see so many papers and so many analysis that use odds ratios, right? So I think we just have to become familiar with it. So if X goes up by 1 unit, log of odds will go up by the slope, the beta 1, right? The log of the odds of this event that we are interested in, like anemia, increases by beta 1. But we don't really want log of odds. I mean, at least let us have odds, right? But then if X goes up by 1, the odds of the event will be multiplied by e to the beta 1. So now you're talking about odds, and it's not increasing by the same amount, it's being multiplied. And that's a new idea, and we'll talk about what that means. And then if this beta 1 is equal to 0, we were just saying, right, e to the 0, so e to the 0 is 1, you're multiplying by 1. So the odds is multiplied by 1, it's staying the same. So if beta is equal to 0, this beta 1 is equal to 0, the odds will stay the same. It's like no effect of X. Okay. Okay, let's stop there. So interpretation, and that we'll talk about a lot, like how do we interpret what this is and how do you communicate that? And then this is just some math for your reference. Here's our model again. Again, we can talk about odds. So we don't like the log, so we might exponentiate it like we did on the previous slide. Or we might just try to do some algebra and solve for P. So here's the formula. Your software can calculate this for you, but sometimes it's just nice to have the formula. If you have to figure it out by yourself, keep it as a reference. The software should be able to do it. Because sometimes we just want to talk about the probability, like you just want to know what's the probability of anemia in this scenario. You don't want to know the odds or the log of the odds, just tell me the probability, right? That's the simplest idea. So here's a formula, just you rearrange, solve for P, and that's what you get. So it's possible to get that. So let's do that. If you look at anything tonight, if you're revising and you're looking at this, stare at this one, you got your model, and you try to think of what is happening to log of odds and of odds, and what it means for the slope to increase by 1 unit. Because that is the key to the interpretation. Okay? We'll do lots of examples tomorrow.
So the non-hypothesis from this formula, the non-hypothesis will be expected to see B equals 0.
Mm-hmm.
And then
As always, yes, the slope being equal to 0 will be the null hypothesis,
it's in another
which is the same as saying the odds is 1.
okay. You know, the odds will be-
Odds ratio will be 1. Yeah, exactly. Yeah, okay. Okay, let's stop there. Good stuff.
Starting here.
Okay, so if there are questions, we can do questions. If you want to, you need to go and do your work, that is okay. If you want to stay and talk for the next 1 hour maximum about applying for PhDs or graduate schools in the US, if you are interested or your students are interested and you want the information, I can just talk a little bit about that and answer some questions. Yes, okay, yeah.
Yes.
Yes, okay.
Now before doing.
What's that?
Say doing means
Okay.
yes,
Okay.
likely yes.
Okay. Are you good? Do you need like a 5 minutes break?
Yeah, great. About okay, 5 minutes break
5 minutes break. Okay, okay, let's do that.
for energy exponential. Sampai ke dari halaman itu tidak boleh kualitas.
I'm gonna add it to the notes. Let me add, you don't need a master's.
Don't need master.
Mhm.
Apply for PhD.
Yep, yep.
Because we move forward with our student last year we have about 13 master students.
Here, put it here. I think, Kat, for your question, it's not required. Certainly, a student who has a master's is better prepared, can probably be more successful, will probably take less time for a PhD. But those who don't have a master's will probably take more time. You know, if you have a master's, it might be that you're more competitive. It might be that you're more comfortable with research. But also, I think sometimes it's helpful to get a master's because there's always the probability that something goes wrong. So if you do a 5-year PhD and in the 3rd year you have some challenge and you don't finish, you've wasted 3 years. So some people will get a master's in the process of getting a PhD. Not everybody, but sometimes.
So then, master is it.
Yeah, but people do it in many different ways. If everything goes smoothly, then it really doesn't matter. Because once especially unless it's a different topic, right? Like, so for example, I have a master's in genetics, but I have a PhD in statistics. So that, it's like 2 different topics. So it shows that I'm trained in 2 topics. I also have a master's in statistics, but I never tell anybody. Because if you have a master's in statistics and a PhD in statistics, nobody cares about the master's. Because you just say you have a PhD and finish it, right? Like, so it's either an insurance in case something goes wrong, you have a master's degree at least. Or you have a training in another topic. So it's very common, for example, if you have a nutrition PhD, maybe you get MPH, Masters of Public Health. So it's a nice combination, right, of training.
But that is full time, right? Full time.
Oh, yeah. Yeah, you cannot, and okay, that's another thing to mention.
It's for the because the
What is
Each plate is for one of them. Yeah, exactly.
Okay. Okay, you guys. Ready? Okay, I'm gonna speak very generally and you guys can ask questions. And I wrote this like a Word document because like as I think of more things, I keep adding. And maybe I keep adding as we go and I'll share what I have today, but the more you ask questions, the more I think of things that I can share. And of course, I am like 1 person, sample size of 1 is very low power, so I can't speak for the whole American, every subject and every discipline. There's so much variability, right? So caution, caution, caution. You should look for other information, but let me share at least what I know from my experience, right? So what I'm talking about here is MS and PhD in United States universities. And mostly I would say it's PhD. MS is usually, it's a shorter program and there's maybe less opportunities and it's very short. So I would always push towards more of the PhD side, but these comments are applicable to both. So in the US, the cycle happens once per year, usually. There are always some exceptions that they happen in the middle of the year or something, but usually there's a very fixed calendar. So that happens once per year. So if you are planning, for example, if you make an application in the next few months, say you were thinking about, I want to go right away and start a PhD. If you apply in the next few months, you would start 2024, August or September. So basically 1 year from now. If you start now, you would be starting your studies 1 year from now. It's a long process. And if you miss that cycle, then sometimes it's possible to get an admission in the middle, but most of the time you have to wait 1 more year. So it does take planning. Every institution, and even inside one institution at Purdue, we have many departments. You apply to a specific department like nutrition science or public health or psychology or, human development. Every department might have a different application deadline. So it's important to check exactly for this particular degree, PhD in nutrition science, what is the deadline? And it might be different from the PhD for public health. Might have a different deadline. So check that. Usually those deadlines are November, December. So you have to get all your materials together by that deadline. Then they will review the applications and so on, and might take 2-3 months. And so they will make some kind of offer, like they will give you, are you admitted? Are you rejected? That decision is usually made in the beginning of a year. And then they want to get your response, your commitment. Are you coming? Are you not coming? And this date of April 15th is usually very universal. That's actually kind of a national policy when people get admissions to universities, because all the universities are competing to find, the best students. They all have a common deadline for you to make a decision. So if you apply for 2 programs and you get admission for both, you have to tell one I'm coming and by April 15th, and the other one I'm not coming. And you make a kind of commitment that way. And then you would study, then you do your visa and all your planning, all this process, and then the study begins usually August or September. Different institutions will have different calendars, but that's the starting time. So the school year usually starts the beginning of the, 1 year of study, you start in August or September. That's the common thing. So PhD programs in the US, the typical time is 4 to 5 years. It's not quick, right? You can find European programs that are shorter, for example, but the US program can be 4 to 5 years. Some people will take longer. I mean, it depends on your background. So Ketmani was asking, do you need a master's? You don't need a master's. However, if you go from undergraduate degree and you start a PhD right away, you probably will take longer, right? People who have some master's degree, they have some training already, they can move a little bit faster. So the time is not fixed. Some people will finish in 4 years. I've known some people even finish less than 4 years, but they really work hard and they usually have a master's already. Some people take 6 years, even 7 years. So very uncommon, but it can happen. The time is not fixed. The first couple years are very heavy with courses. So you take multiple courses on the subject so that you get a very broad knowledge. You will do some things that are very related to your interest and some things that are just good information but are not related to your interest. And of course, I am biased. I have bias, right? But I think that kind of education, I find that very helpful, because when I did my PhD in the US, I took many courses. Some of them I didn't need for my PhD, my dissertation, but they were very helpful later in my career. I was very glad I had that chance to learn that topic, because later in my career, I did different things. I needed that information. And it's just so easy to learn in school. It's very hard to learn on the job. So I think it's actually a nice opportunity to take more classes, to learn more things and have a very good foundation. And then for your career, you can keep using that foundation.
It's positive bias.
What's that?
Positive bias.
Of course, it's a positive bias. But you will not escape coursework. And that's one of the reasons why it takes longer. Again, I know in many European programs, the coursework is very little. And it's positive because you can move fast, but I would say it's a little bit negative because you don't get that knowledge that can help you later in your career. So the important thing, okay, so there are many things, and anytime you guys have questions about the timing, anything, just ask, okay? I'll try to go quickly because I know it's already 3:30, probably you're tired. And we can always keep having this discussion, tomorrow or
Where's
whatever.
sorry,
What's that?
transcripts?
Just wait, I'm still on funding. Let's talk about funding, because this is an important thing for most people. So most people need some kind of financial support, right, to make this happen. If you have lots of money already, then everything is fine, of course. But for most people, they need some kind of support because 4 or 5 years in the US, it's a long time, right? So the process of getting admission, there's really two processes. One is the admission. Do you qualify? Do you meet the requirements? Are you a good candidate? On your background and your skills and your application. The second part is the funding, right? So it's very possible to get admission, but not to get any funding. And that is a problem because the education and just life in America, it's expensive, right? It's going to be very expensive. So my just general recommendation is that, unless you have like a constant, very stable source of, like resources of your own, like if you get admission and you don't get funding, just say, never mind, thank you very much, goodbye. You need the funding as well. And the funding, what that usually means is this. So you get, and it's not a lot of money. It's not, you will not be wealthy, at all. But hopefully you can it's survival level funding. You get a monthly salary, and then you get a tuition waiver because the education is not free. There's a tuition, there's fees, but that one is canceled for you. So you don't need to take a loan, you don't need to pay. There might be like some small payments you have to make for like fees, and they have some small things, but the tuition is usually like thousands of dollars per year. That will be covered by the funding. And then there is health insurance, because also American healthcare, you absolutely need a health insurance, and then the university will pay for that health insurance. You still have to pay something, but not the full amount. So these are like 3 very important things. You need you need some money for survival. You need to not pay tuition because it's very expensive, and you need to have health insurance because it's also healthcare is very expensive. So those things are important. This sort of situation varies a lot by institutions. So, and even within an institution, within one university, different departments and different programs might have different policies. So I know many ones who give admission and then they don't give funding, and they say, well, go find a scholarship, or you get some sponsorship from somewhere, and then you can come. Like, yeah, okay, yeah, if you're lucky, if you can find for some sponsorship from an outside source, then you have the admission, you can come, no problem. Some of them will say like, well, we can give you funding for 1 year, but this program is 4 or 5 years, right? So what happens in year 2? Like, what if you can't find something for year 2? Do you go home? Like, what do you do? So these things can be stressful, right? And you want to once you have a letter offering you admission, you can start asking these questions, right? Like, I wouldn't wait, don't get the admission first, and then, you can start saying like, okay, what is the funding? Is it guaranteed? For how many years are you guaranteeing? Sometimes they will say, we'll guarantee for 4 years. And then fifth year, like usually they will try their best, you know, but it's not guaranteed. So you can have those discussions. When you do get funding, there's different opportunities. So a common one is a teaching assistantship, which is basically you're assisting on lecturing. Maybe you do like discussion groups or something like that. So you're doing teaching of some sort. So that's your job, and that justifies getting the monthly payment, the tuition waiver, the health insurance, because you're like an employee, not a full-time employee, because obviously you have to do coursework, you have to do a dissertation. So you're like a part-time employee. So that's a teaching assistantship, your assistant teaching. You can have a research assistantship. So for example, if I'm a faculty member and I have a new project and I have some money on that project for a student, then I can use that money to pay for your stipend. And so then you're a research assistant and you work on my project, and then you do your coursework and you do your dissertation, and that's how it goes. Sometimes it changes. So maybe in the first year, you're doing teaching, and maybe the second year you've moved to research, you know, and then maybe the grant is finished. So the third year you're teaching again, and so on, you know, so things can change as you go along. There are very limited, but there are some opportunities for scholarship or fellowship, where there's some third part, like maybe in the university, the top applicant will get, you know, like their funding covered, or, you know, so these are kind of competitive. At my university, everybody who applies, who meets the criteria for admission, gets automatically considered for any kind of opportunity like that. From year to year, the opportunities vary. Sometimes we have a lot, sometimes we have very few, like it just depends. So you're automatically considered. Other times you have to apply. Sometimes there's eligibility, like maybe they're looking for international students, or they must have Americans, or you have to be, there's like all different kinds of, you know, things. So that can vary. The important thing is, one important point, and this happened to me, when I first went to my PhD, I was doing a master's in a different topic, and then I wanted to switch topics. So I applied for this master's program. And then they said that I was a good candidate. And the professor who was in charge of the program, she said, like, you said you want to do a master's degree, but if you just tell me you want to do PhD, in the application form, you know, you check master's or PhD. If you just change it to PhD, then you have more opportunities for funding. That's usually true. The master's is usually fewer. The PhD, they put more resources. So I would say, so what that professor told me was actually, why don't you try a PhD? And just tell me, like, let's see after 1 year, if you have to go back to master's plan, okay, fine. But if you say PhD, you have more opportunity. And indeed, I got some more funding from just telling her I want to do PhD. And I ended up staying in the program. I got my PhD. It was good. It was very good advice, and it was very helpful. So I would think, if you're not sure, like, I would say just say PhD. Even if you have a little bit of doubt, you know, you can change the mind later, right? You're not held to it. Okay, I didn't finish writing this. So there was another comment that happened. This is something I want to check. So it is really not possible to do other jobs when you're doing a PhD in the US. I mean, sometimes people will quietly do something because they need money, or, you know, something, but in general, like, you should really plan that time for your studies and not extra things. And as far as the visa is concerned for in the US, you are limited. As an international student, you're not allowed to do other work. So that's the thing you just have to be prepared for. And the work, being a student, it's a lot of work. There's not free time to do extra activities. So you shouldn't plan on that. Just gonna say visa. There's I can find the exact details of this, but usually the student visas in the US, there's a certain number of hours that you can be employed, and I think you have to be only employed at the university. So you can't go to McDonald's and find a evening job or something like, it's not gonna work. So you have to be prepared for that. Okay, so typical requirements, you need a CV. Questions, thoughts? It's okay?
We will not go to McDonald's for sure.
Ultra processed food, right? Some people, you know, there's different circumstances. Okay, CV. So it's a CV, not a resume. I'll talk more about this in a minute, but the CV is a resume is like a short document about your whole education and history and so on. A CV, it can be a much longer document. A resume is like a very kind of, it looks very fancy, you know, it looks very like nicely, the colors and everything looks very smart. A CV is a very boring, long document, but it's very comprehensive and it tries to communicate, you know, your background. What I would recommend, and I wrote it down below, but you know, every country has kind of norms. This is the normal way of, for example, making a CV. There's a certain kind of expectation of how that looks. So when you're making an application, you know, you want to kind of meet that expectation, right? So one thing I would recommend is if you look at the CVs of assistant professors in the US. So there are professors, but they're kind of junior. They're just starting their career, so they're similar to you, right? You have some similar background. Look at what their CV looks like, how they present themselves, what is the formatting, what is the content, what do you include, what don't you include? Actually, I was looking at this while I was thinking about these things. So let me just look at a couple with you. And let's see, not that one. Yeah. I just looked in my own department. I looked at a few ones. This is one assistant professor who is in my department. So you can see she has a document, it's 13 pages long. And that's okay. There's no penalty for length for a CV. If it's long, it's okay. You want people to read easily. This is a little bit old. She needs to update, but that's okay. She has her education, her jobs that she's held, and then she had some job in academic and in industry, so on, you know, so there's a certain, you can see how it looks, right? She doesn't have so many colors. Everything is very organized. It's very comprehensive. And it shows how she's working in, you know, she has publications, she has some grants, some things. So you can just look, I think an assistant professor level, that's a good model to just, you can even just copy the formatting and add your own information. Notice there are not things like that are personal. Like you don't need to say citizenship. It's not relevant. Marital status, date of birth, your photo, none of these things are necessary. And actually they're better without them. Because in the US, you cannot discriminate. Like by law, you should not discriminate according to something, right? So I can't say like, oh, you know, she's too old and he's too young and, you know, this one's married and does she have children and like maybe they're not serious because they have like all those kind of stereotypes and discrimination and stuff, those things are not allowed. So we don't put citizenship, we don't put date of birth, we don't put a photo. Those kind of marital status, those things are, it's not supposed to be a basis to evaluate you, so it shouldn't be there. So when you look at these kinds of examples, you'll see that. So the transcript is the academic record from your, for example, from your undergraduate or from your master's degree. You would probably need an original and probably a translated English. You need something in English as well that's kind of translated. So that is meaning like for your undergraduate degree, these are the courses, and then this is the grade. A, B, C, D, or GPA, you know, 7 out of 10 or whatever I don't know how it is in Lao. So the grades that you get in every course that you've taken. So there's usually an official document from the university. And you get, and you will have to certify somehow it's from the university, like you didn't type it yourself, right? It's an official record of your training, and you need that for every degree that you have. So if you have a master's degree, then you need the master's and the undergraduate. Sometimes this is a pain, right? Because you have to do it, if it's in Lao, then you have to translate to English. In an English version, that's fine. If you did a master's degree in Europe and it's in French, then you need the original French and the English version. So it takes time. And you have to contact the university, have them send the document directly. Or maybe you get it and you upload it. You have to read the rules when you make this. The applications are always online. Read the rules and do it. And leave enough time for that. Another thing you have to do is a personal statement. It's like an essay, maybe 3 pages, not more than 3. Definitely less than 3, maybe 2.5 or less. 2 is nice. So it should be well written, and I can talk about what that document has. There is sometimes something called a diversity statement. Sometimes it's there, sometimes it's not required. Sometimes it's called optional. And then you have to decide whether you're going to do it or not. You have to get letters of recommendation, usually 3. So you want to get letters that are written in English from maybe professors, you know, boss, like you can choose. But I'll talk about the content of those. You do have to take an English, this IELTS or the TOEFL. I think now this IELTS is becoming more common. They have, you have to plan a date for that. You have to pay for that. And you have to get a minimum score. And like, for example, in my university, if you go to the graduate school of Purdue University, they will tell you like the requirements, like the IELTS has like different like reading and speaking, something like that. So there's like minimum scores for each, and then there's a grand total, which also has a minimum. And it's not easy and it's expensive. But you can keep taking again and again, if necessary. Like you can repeat, and that's not a problem.
Is there any exception for the IELTS or TOEFL?
I don't know. This came up to me last year. I had a student who seemed very nice who wanted to apply, and she didn't make the requirement. And it was sort of like, okay, how can I ask this question without sounding like I'm trying to break the rule? Because I wanted to ask, like, are you really checking? But you don't, anybody can check, and then just because it's clearly stated, usually this is the minimum score. So you have to find out what that is, and you have, it's better. The other thing is, you hear me talk and you hear Kate and even Roger and Carmen, like we are the typical, that is what you're going to hear all the time, right? So you're going to be in an English environment, and it's an American English environment, who have all the accents and, American sounding talking. And so you have to be able to function in that medium, right? Because when you come, you will immediately go to coursework, right? Which means you're attending lectures all the time. And if you can't follow easily, then, or if you can't read, because you'll be reading a lot of textbooks, you'll be reading a lot of papers. You do have to be comfortable.
Yeah.
Otherwise you won't be successful.
But somehow, in some way, the IELTS and TOEFL obstruct somebody who cannot pay for an examination, or even make another difficulty for somebody who really intends to study.
Yeah, I know.
There's a chance of that just because of that score.
Because of money.
And also myself, let me share a little bit. When I did my master degree, I just write to them that I was in the environment of using English by document or by communication, and they just allow me to go for master degree for the international curriculum, and I just take later on during the course I just take exam there, and even a PhD in Amsterdam. They don't require any score of this from me, I think like that.
Yeah,
Not a
it
comparison, but
depends. It really depends on the institution, and maybe Europe is a little bit more nice. Like, yeah, so the question, yes, you can always try to say, and money is unfortunately a barrier for all this, because there is this exam, there's an application fee to submit an application, and then of course you need money to go. I mean, you need a plane ticket, right? Like, money is a problem, and it is a barrier for sure. You can try to ask, like, if you say, like, I can't afford this, what can I do? You know, it might work, but I'm not very optimistic sometimes about that kind of thing. It might depend on the program if they're willing to waive it. But for us, some of this requirement comes from the graduate school and not from the individual department. So even if I say, or even if my department says, doesn't matter, we don't, you sound fine. There is a waiver. So there are exceptions for certain countries, but it's usually countries where the English is like more commonly used. So even in Sri Lanka, the universities are in English. Maybe first year, no, but like it's in English. So people are taught as undergraduates in English. So you think it's okay, but actually they say, but in the country itself, we don't speak English on a normal, only for very official purpose, right? And so people are not, so they wouldn't have given exception for that. I think like maybe like Nigeria, where they will use English more commonly in regular society. So at Purdue, there's actually a list of countries that have an exception. But for example, Sri Lanka, where they have English medium universities, they didn't give an exception. So yeah, this is a problem. One thing that is good is that many programs now do not require GRE. You guys have not heard of GRE? Okay, that's good because most programs do not require. This was another exam that you had to take. They do English, math, and analytical reasoning. So it was sort of like an exam to get into graduate school. Now, either they don't require or they say optional. I would say, like, if it's not required or if it's optional, drop it. This happened mostly because of the pandemic, because you had to go and sit for the exam. And when the pandemic came, infection, and nobody was allowed to sit for exams. And so for 1 year, they said, okay, we'll waive the requirement. And then the next year came and they waived the requirement. And so now I think many universities have moved away from it.
What does it stand for, GRE?
Graduate Record Examination or something like that. You might, if you find a program that you like, just if you see it, go Google it. It's an exam. It's like doing IELTS or TOEFL. You sit for the exam, but they have mathematics and English, and they call it analytical reasoning. So it's like logic and stuff like that. And then there's an application fee. And the unfortunate thing is for every university, like if you want to apply for 5 programs, then you have to pay 5 application fee. So the price can increase. And then again, a master's is not required. So I can tell you a few things about these things. Let's see, this is not a complete list, but we talked about CV, we talked about transcripts. One thing I would do, every program has many applications, right? And there's a limited number of spots and there's limited funding. So, and everyone who applies for PhD is usually good, right? Like you can't say like I am just such a good student, because everybody is a good student. You can't say I am so passionate, because everybody is passionate. Otherwise, why would they apply for PhD, right? So, okay, those things, like you want to convey that you are smart and convey that you are passionate, but that's not enough. You have to do more than that, right? So you're just trying to think of things that will help you look a little bit different from the average person. So one thing you can do, and one thing I actually strongly recommend, is just, if you're interested in a topic, go, go on Google Scholar, read papers, right? Like go find papers, find things that are very interesting for you, and then check who is the corresponding author on that paper. And just go send them an email, right? Send them an email that says like, just say, are you looking for students in the next year? Make sure the English is very good. Make sure that the email is very short, like not too long. Attach your CV, make sure the CV looks very good. Just say like some brief things about you and how you would like to do the PhD. You might say, oh, Dr. Edens, I read your paper on social network analysis in Kentucky, looking at maternal health or something. And, that's a nice way to get someone's attention, right? Like I found that very interesting and would love to do a PhD and do research on social networks. And then, basically there's two things that can happen, right? Like, or a few things that can happen. One is they're too busy and they never respond, right? And that's okay. Like there's no harm. Yeah,
to be totally real, that's often, like I
Yes.
probably get 2 or 3 emails a day
yes,
from potential
yes,
students. And yeah, often and right now I actually can't take any primary students just right now.
Mhm.
So yeah, I thought, oh, I need to create some kind of auto response and just.
yes, a general form thing, like,
Yeah. But
Yeah.
it is.
yeah, so
We sent it multiple times. I was nervous.
well, and sometimes, so the thing is that a lot of this is really dependent on the advisor, right? Like, and that depends on that advisor's circumstance. So you could be the best, most promising, perfect candidate, but maybe I already have, like right now I have 3 PhD students. I really don't want one more. Like at least for now, until one of them graduates, like 3 is a lot, and like I'm happy, right? And I don't have any new project. So I have money for my current students, but I don't have money for number 4. So if you email, like if somebody is emailing me, like honestly, I would say like I'm probably like, okay, something can happen, that maybe the chance comes I change my mind, because right now I'm thinking about 1 year from now, August 2024. So something can change in 12 months, right? But realistically, like, so even if you are the dream perfect student, like I might just say like, I can't, right? And it doesn't mean, and that's the same thing, even if you apply, even if you are the top candidate, like I'm thinking of the current batch of students we're getting who are starting now in our PhD program. There were some that were really good and we rejected them because we just didn't have the funding. Like the faculty already had students, we didn't need more, we only had funding for this many, there was a certain matching. If somebody is so perfect and they're studying social networks, then for me, like that would not be a good student, right? Even if it's the smartest student, like it's not a good student for me. So I would say like, no, I won't take that student. But if Kate is, has an availability, then of course, like, fine. So it's not that you are a bad student or a bad applicant. It's really like, is the opportunity available now? And a lot of times it's just not, which is why it's good to go around, ask people. So just send an email, make it short, make the English very nice, attach your CV, explain your interest. You could say, can I talk to you for 15 minutes? Some of them will say yes. And if they have a new project, like, so sometimes you have people who are very busy, sometimes they have no opportunity. And then you have the other side where people really they have a new project, they need a student very quickly, they're desperate to find somebody, and then you come along and you're perfect, right? Like, so it's possible that is happening too. So some of them might say like, yeah, let's talk. I had a student who was a master's student and I told her she should, go somewhere else for a PhD and like explore her interests and so on. She emailed somebody who was like top of the field and said like, I have this background, and they had a project where they really, really needed a research assistant. And they had the money, they had the project, they didn't have a person. And she just sent an email and like, they were like, please, like hurry, it happened very fast. She joined that program, even after the deadline, because they just needed somebody. So it can happen, it's not common, like, you know, there's only so much opportunity, but like, you should just try. But a PhD is so, it takes so much of your energy and so much time in your life that you want to pick a topic that you find very interesting, like you really are excited to do it, because otherwise it becomes so tiresome, right? You'll get tired. Like, even when you're frustrated, you want something so interesting that you can keep working. And the other thing is, a PhD advisor has a lot of power. Like, just to be very honest, that person has a lot of power. That person will decide when you graduate, if you graduate, are you going to get funding? Are you not? Are you happy or sad? Like, they have a lot of control. So you want to have a person who is not crazy, right? Like you want to make sure that that person is okay, like that you can work with them, that they are fair, they're reasonable. And sometimes there are people who are truly crazy, and then there are other people who are fine, but their style is not a good fit for you, right? Like when I did my PhD, my advisor, he didn't check everything I did. He was very loose. Like he was not very strict. Like I did my thing, I did my work, and he was there. He gave advice, but he didn't check work all the time. And for me, it was nice because I didn't get pressure from him. For me, I had my own pressure and I didn't need more pressure. So that personality, that was a good fit. There are other people who find that really troublesome. Like they're like, this guy, he's too busy, he's not available, I need advice, I need more support and input, and they want more structure. And this kind of professor would have been terrible for them, right? So you have to see what kind of boss, basically manager, mentor you want to have, and make sure that that is good.
And you can always fill that out too, with, so when you're building your committee, once you're in, then you can also supplement, you can choose other people to be on your committee that help meet some of the needs that your primary advisor doesn't.
Right.
But, and I don't know if you said this exactly, but I know like for our program, if you've applied, then everyone who's reviewing applications is going to read through your application. And if at that point you send emails to faculty to really gauge interest about your fit for particular faculty, that's good too, because that can, then they can begin to advocate for you as someone that they would like to be the primary advisor for. And we also, sometimes we have options. I had a student who applied and we didn't have funding. He was accepted but deferred for a year. And the next year we had more funding for him to start. And in that period of time, I moved from tenure track to a research track, so I couldn't be his primary advisor, but I'm still a participating member on his committee, and he has someone else as a primary advisor, and it's fine. In the first 2 years, you're doing the coursework, so you don't need that much direct input as well. But all of that can vary drastically, like you said, from program.
Right. Yeah, I think
how many applicants they get.
Yeah, another nice way to, if you can find out who is someone's current students or their most recent students who recently graduated, and you have, some contact with them, you can ask, right? Like, and for me, like I tell anyone like that to talk to my students, and then I tell my students to just feel free to talk. Not every professor is like that. Some people are a little bit more, so like, but I think that is a nice source of information. See who has worked with this person. Like, are their students happy? What do they say? Students will talk. If you can get in touch with them and, kind of get the honest story, it's good to know. It's good to do that research because you're starting to work with somebody that you haven't met for 4 or 5 years, right? It's a big decision. And it is possible to make changes, but it's a little bit difficult. So, yeah.
And you might even reach out to there's usually a staff person who's in alumni relations at the school. You could reach out to them and ask for recent graduates, but I would ask, what is it like being an international student in this program? Because that might vary by programs as well, and you don't want to go somewhere where you hear that international students aren't getting the support that they need to graduate, to improve English, to do all of these particular things that they might need. So I would really do a lot of research if you can, and also keeping in mind that advisors can move. So you can start a PhD somewhere, and then the person you want to work with might leave. And that happens. And maybe they'll give you an opportunity to go to a new program with them, but maybe they won't. And so you have to also like the program itself. And just in case the person you want to work with ends up getting a new job somewhere else.
Right. It's not common for that, but it can happen. Yeah.
Pretty common.
Okay, my battery is about to die, so if you want to take a photo of this, that's fine. I'm just gonna open it here while I can. Let's see. So I have it. What did I call this? Fine. Okay. I don't know. Now the internet's not working anyway. Okay, that's okay. I kind of know what's up. Okay, personal statement. Let's talk about that. So personal statement, really, that is like 2 pages, maybe 2.5. Don't make it too long. If it's 1 page for a PhD, it's a bit short. I personally, okay, people will have different opinion. I think it's a bit short. If it's only 1 page and you want to do a PhD for 5 years with 1 page, I don't know about that. But if it's like more than 2 pages, like, or 2.5, like, you know, then it's too much and people are not going to read it carefully, right? The purpose of that is to know like what you want to do and why. And I think this is a hard one because I have read many statements. They're like, you know, ever since I was born, I loved nutrition. Like, no, please don't do that. Like, you know, or my mother cooks and so I like food. Like, no, like I do actually read things like that. So please don't write things like my mother cooked and no other mother cooked and I love food. Like, please, like, okay, but it's okay to write about your personal experience, but it's also about like why you want, what are you interested in? Right? Like, what do you want to study and why do you want to study it? But like, what are you, if you get a PhD, like, what are you going to do? Right? And I think sometimes that's hard because sometimes you just want the opportunity or you just want a good job and you can't just say, I want a good job, right? You have to say that you have some vision, some plan for the future. You want to improve nutrition in Lao, for example, or you're interested in, you know, maternal and child health in globally because there are so many challenges to good maternal health. And this is what you want to improve and you want to study interventions or something like that. So you have to have a bigger vision than I just want a degree, right? The other thing that is really very helpful is because the PhD is based on research, it is helpful to know your potential for research. So one of the big questions we want to know is, can you do research? Now, for all of you who have some background in research, that is good because you have experience. If you have 0 experience in research, then it's a bit risky for the program, right? Like you might be very good or you might be terrible. Like it's hard to judge, right? But if you have experience in research, one of the things I really look for is like, can you talk about it? Can you write, if you did a project already, can you write 1 good paragraph that is like, I did this research. What was the significance? So these are all the Carmen things, right? Professor Carmen said, you know, why was it important, right? Like I studied child malnutrition in northern province of Lao. Like, why is it important? Like children, you know, malnutrition affects, okay, there goes one. think my battery just died. Like, why is it important? Right? What was the rationale for this research? What was the gap that was missing that you were trying to fill? What were your objectives? What were your methods? What did you find? And why is it important, right? What is the significance of your finding? What is your contribution to knowledge? If you can write that paragraph well, it really reflects on your ability to do research, right? If somebody, for me, like a warning is if somebody says, okay, I did a research project, they might even say, I did a master's degree on child health in Uganda or somewhere. And then they don't say anything else, like, then I'm like, okay, why not? Either they're not interested or they didn't really understand their research, or they were just confused, like, and then they'll come here and be confused more, like, so that's usually a warning sign. So if you can demonstrate your clarity of thought and your ability to do research, I think that's one really nice strength. And you can fit it in the picture of your whole kind of larger goals, like it's fantastic. So that is useful. Another useful thing to do, usually at the end of such an essay, is to say, like, if I come here, like, I'm excited, I could potentially work with, and then actually mention a few names. So if you say, like, I come to the Department of Public Health at Purdue, I might work with Nilupa Gunaratnam because, she works on these things and I'm very interested in that. Or I can work with, there's a few other global health professors. Like this one does like kind of health systems and human rights, and this one does, whatever their topic is, so then you identify. So when you mention specific names, those people kind of pay attention, or they get the message, we wrote a paper or wrote an essay and she mentioned you, like, do you want to look at her application? Yeah, maybe. So you give a little bit more attention. If you mention only one name, that's a bit risky, right? Because if that person doesn't want students, until next year, like this year, you're out of luck, right? So maybe mention 2 or 3. And it's actually good to find programs where you can identify 2 or 3, because again, someone might change institutions, someone might retire, someone might, have a medical problem for the next 5 years. Like many things can happen. So if you have only one professor in the program and you go there with a 5-year commitment and then something happens, then like, what do you do, right? So it's good to have kind of more programs where you might have more than one option in case, just in case, right? What else did I have on there? You know what, I think I emailed myself this thing. Letters of recommendation. I have never read any letters of recommendation from Lao, but I have read letters from many other countries. I think this is a bit delicate, right? Because usually you need probably 3 letters. You want people to really talk about your potential as a scientist, right? You don't want, like, I see letters of recommendation that say this person is very punctual, or, I don't know, like, who's a very good, I don't know, does everything I tell them or something like that. Like, no, like you're not, I'm not, the PhD is not like, you're not looking for an employee. You're not looking for someone who will be very obedient. You want somebody who will be a good scientist, right? So they should talk about your potential to do science, to have an impact, things like that. If they can, and you can help them maybe, depending on your relationship. In the US system, I think Americans and Europeans are sometimes different. Europeans tend to be like, let's talk about positive and negative and this kind of things. Americans just want to hear the positive. You don't need to give a very balanced assessment. It's kind of nice if it's just positive, right? So Kelly's smiling, but I think that happens at all levels of universities. Like, but you do want to, again, talk about the potential of that person. What else? What else was on the list? You can talk. Mentors. Oh, a lot of this stuff, like for example, the statement, the essay for application, this stuff is on Google. Oh, yeah. Thank you. Nowadays you can find examples online of good essays. Don't find one, like find multiple, and just kind of look at how they seem, how they write, just to find examples. I think that's helpful. So look in Google, but be like sensible, right? Like look, like the type of essay that you might write for engineering might be different from biostatistics, might be different from nutrition or public health. So like just look at different examples and get the idea of the way of writing, but don't look at one example, look at many and kind of compare and then go from there. Oh, thank you. Yeah, so personal statements, what is your big picture plan? Let's see, we have transcripts, diversity statement, let's talk about that. Yeah, I think that's the main one. Diversity statement is a new thing. Sometimes it's not required at all. Sometimes it is completely required and sometimes it's optional. I find the optional very complicated because you're always thinking, okay, it's not required, but is it good? But if I write it badly, is it bad? Like, you know, it's a bit confusing. These kinds of things depend, honestly, and Kate and Kelly can both attack me because I'll give my personal view. But this is very new and it's a lot of times it's rather focused on the American situation. It is kind of looking at, you know, issues of inequity in the United States, and they want people who are aware of the issues and care about those issues. And when someone from another country is talking about equity, they're talking about it from their own experience. It's not necessarily applicable to the American experience, and they get kind of lost. Like, you know, and so I find it a little problematic, but for example, my department, because it's a public health department, like very much values this because they do value equity, but they just tend to view it in an American sort of way. So it's a bit tricky, but basically I think what they want to hear is that you bring some interesting, diverse experience to the student body. So as a student, you are going to contribute your experience, both personal experience, but also your working experience, to the larger community of students and to the larger department, and they want to hear about that. So, for example, if you're, and a lot of this is about working on issues of inequity. So if you are working on, and all of you, I think, work on equity issues because you work on food insecurity, right? You work on malnutrition. You work with vulnerable populations and disadvantaged populations. So if you can talk about that, I think, and why do you do that? You know, why is it important? Why do you care that some people are hungry or some people have malnutrition? That would be valued. So explaining kind of what you offer in terms of personal experience, but also work experience, and show that you have a commitment to do that as a student, but also in your career. That you have an interest in working, you know, if you're working on food insecurity right now or malnutrition right now, maybe that's something you want to continue. And in your career, this is a thing you want to address, that there's nutritional inequalities and we want to help uplift people, right? So it's just showing that you have that commitment. Because some people, you know, don't care about inequities. And that's, you know, this is valued, equity is valued. So again, and things like this, and actually even the personal statements, all of these things, you know, you're writing the best you can, but you're also kind of trying to match the culture of a department that you don't know, right? And sometimes you have a good fit and sometimes you don't. You know, so I wouldn't worry about it too much. I think but you can get a little bit of that idea. So for example, if you come to our website, for our department, you will know that health inequities is a big area of research, right? That the department is rather serious about it. So, you know, if you're like, I don't care about this, then obviously they will notice that and think that you're not a good candidate, right? So you can get a little bit of idea of what the priorities are by kind of, seeing the website and so on. And also see if you're a good match for that environment, because you may or may not be, or you might not enjoy it. So see where you fit in culture, because again, you have to live there for 5 years or 4 years. Any question? So much information. Yes.
So, so the applicant can be any background or should be background from health? Or
It depends. I mean, if you want to study engineering, then you apply to an engineering program. I mean, I'm speaking more from the public health science kind of area, but if you want to apply for biostatistic, well, not you, you already have, but like other people. But if you want to apply for biostatistics, it's going to be some difference between that and public health, which might be general public health might be different from epidemiology, for example, can be different from human development, right? I think it's worthwhile kind of checking out the program. So for example, in our, at Purdue, for example, public health is very much like what you're seeing here in nutrition science. And I'm also part of the nutrition science department. The nutrition science department at Purdue, there's a little bit of international work. There's a little bit of kind of inequity, kind of public health nutrition work, but there's also a lot of like clinical work. There's a lot of basic science, like people who are studying metabolism, people who are doing rat studies, people who are doing in vitro studies, people who are doing biochemistry, nutritional biochemistry. So if you apply to that program, so some of you know Shushmita Ghosh, who is part of this ANRCB project. She's part of that department. She's doing her PhD in that department. So she has taken courses on metabolism, on biochemistry, on anatomy and physiology that's related to nutrition. The requirements for that PhD required having biochemistry, some undergraduate coursework in biochemistry and anatomy and physiology and so on were required for her admission. If she had applied to the public health department, then she would have had different requirements. It would not have been necessary to do biochemistry. It's nice, but it's not necessary. But we might have looked for statistics and, other kinds of topics that would make her stronger. So it's worthwhile checking out even though, like, for example, public health is a very broad topic, right? So you have to kind of check the program and see if it's good for you. Nutrition science might sound very nice, but, you will be expected to know, metabolism of vitamin D and vitamin K and whatever. And if you don't want to study that for, in your first year, then that's not right. That's not the right program for you. So do that exploration also.
Are there any short trainings?
Not many. You were asking, yeah?
I saw the IL and for minimize score, but yes, all my question like that. Maybe the minimize score will be 7 some conflicts, but if have opportunity to give us to train more before we got the score is possible, or we should have the minimize and go to first.
I'm sure I don't know these exams very well. I don't know how you know more about them. But like any standardized test, I think you can study and exactly for that test and prepare. That doesn't mean you are like professor of English. It just means you study for that test and learn how to do the test well.
And if your score, you can go online, there's a lot of like a practice exam, like a big practice exam, you can take to give yourself an idea without paying money, like we'll give you an idea of how hard the test is, just give you a start of the taste. That's the first thing you can do. Another thing is if you know that you're going to be serious about this and you know that you need to improve your English level, is to do the work as you prepare your application, right? Start like many of you are going to start at Binghamton College in English next month. And Binghamton College does classes to prepare for IELTS and TOEFL, and certainly we would have the support in the project in the next 12 months to support someone who's gonna do that class because of advanced education needs. And like Nilupa said, any official test like that, that's a standard, we call standardized test, the same test, the same everywhere. You can take a class and learn how to do better on the test. Even your English is not better. You have to do better on the test because you learn how to take a test, right? So it's if you never take it in class about how to take a standard test, that can be very helpful, make your score improve very fast when you learn the trick and technique for standard tests. Yes.
Like the Americans, if you go to, there's so many, like the ones who do like the primary, secondary education, like those type of tests are happening all the time. You learn how to do it. Like there's a certain, it's almost like, it's like running a race. Like sometimes I come with like Gatorade or like some sport drink and like you're just ready to go and you do it very fast because the time is usually restricted. So you have to not only do correctly, but you have to do it fast. That is just practice. You just practice it. Like it doesn't make you have good English, unfortunately. It doesn't make you, you will not be Shakespeare, like you just no, but you can pass that test. It's learnable. It just takes time to practice, that's all. You can't just go sit tomorrow. You will see a huge benefit of practicing, I think. That's also, no matter who you are, like I think just doing it again and again and again will probably solve the majority of the challenge of it. In a realistic way, I think either before you go to the US or to some other country or while you are there, like it helps to know English and, because English is the medium for so many things and you're trying to operate in an international level and
you're gonna be expected to read a lot of papers.
yes, like because you don't want to just get admission, you want to be successful. And the US system, when you do a PhD, usually you do coursework for a couple years, and then there's usually some sort of examination. So you don't automatically go and finish a PhD. You have to take your coursework, you have to do okay. You don't have to be AAA, but you have to learn something. And then they have a comprehensive examination. If you pass it, you continue and you write your dissertation, you get your PhD. Everything is good. If you don't pass it, you will have to leave. Like it is a yes or no type situation. So you have to be comfortable reading papers. And these things are all skills that can be improved, right? They're strategies. Like we were talking about the ultra processed food papers. We were talking about how we read them. We don't just start at the top and go to the bottom. We read this and this and this to get the idea. So there are strategies and you can learn them. So it's okay. It's not impossible. You don't have to worry about it, but you have to just